Good afternoon, everybody, and welcome to Medical Projects webinar/live event. My name's Mark Williams. I work here at Medical Projects, and we help students on their journey to medical school and on to becoming doctors. And we've been running webinars probably ever since the first lockdown 18 months ago, something like that. And this is the first time that we've actually done a kind of an extended live event version. And it's the first time that we've also used our kind of professional TV studio rather than just our kind of normal office setup. So we want to bring you the same kind of quality of broadcast that we do on our live courses, but bring it to a live and totally free event for you. So today we're going to be talking about the medicine application timeline. I know a lot of you are probably just going into year 12 or just starting your sixth form or college. And there's quite a lot of things that start to happen around that time. You're just starting new subjects, you're learning a new school potentially. And then you've got this added extra bit in the mix, which is the applying to medical school process. And there's a lot to do in the next kind of 18 months for you that are thinking about applying to medical school. So we wanted just to kind of break it down, put it all in a nice, simple timeline, give you some of the key dates as well, and also give you your first kind of work experience or potentially your first work experience. So that's done and out of the way before you've even started sixth form or college. If you're in year 11 or if you're in year 12 or you're in year 13, it doesn't matter. We're going to cover the entire timeline. So part of this will be applicable to you no matter what year you're in. And again, if you're a teacher or a parent, again, this can be information that can be used for kind of you and your students as well. Cool. So just a couple of housekeeping things before we actually get started. The webinar will finish before 4 o'clock, probably a little bit earlier. I know that's a long time, but we will keep it really interactive, and we'll use the chat and polls and things to make sure that it's as interactive as possible for you. We will send a copy of these slides out for you as well within the next kind of 48 hours. And what we'll do is we'll kind of break up the recording of this into the best parts, and we'll either put that on our YouTube channel or we'll email that out to people. Probably put it on a YouTube channel because they'll be quite large files, so you can always come back and watch parts of this. We will use the Q&A tool as well. If you've not used Q&A, it's down at the bottom of the screen, and you can click the Q&A there and you can type your questions in. If anybody has asked a question that you also want answering, you can hit the thumbs up button and it will raise that question to the top so we know what the most popular questions are. We'll save the Q&A basically for the end. So we'll have all the speakers today here at the end so you can ask all your questions at that time rather than kind of breaking the Q&A up throughout the day. And we will have polls throughout the day as well. Okay, so I've done a super brief introduction of who I am and what we're doing today. So what we're going to do is we're going to just ask you a couple of questions, Firstly, just have you attended a medical projects webinar before? I'll just launch that poll up for you. So that should be up on your screen now. And this is just to help us work out who's been to our event before, whether you're brand new, and where we kind of need to kind of pitch the presentation and the talks today. So we'll give that a couple of seconds. It's all anonymous as well, so it just aggregates the data. So I will end that poll and I will share the results as well so you can see who else is watching this. So 90%, this is your first webinar. So a huge welcome to everybody that is just watching one of our webinars or events for the first time. Welcome. And then the other 10% have been to our webinars before. So excellent. It's great to have you back with us. So we'll just switch back to another poll now. And this is just to help us work out where to pitch the content as well. So this is basically what year are you starting in September? So in a month's time, in a couple of weeks' time, what year will you be starting? Or the equivalent, I know it's year 11, year 12, year 13, if there's a Scottish equivalent or an overseas equivalent. We'll just put them in those three categories for ease, really. Okay, we'll just end that poll and I'll share the results again. So 97% of you are going into year 12 or the first year of college or sixth form in September. And that's fantastic. You know, you've got a lot to, you're gonna have a lot on your plate in the next few months. And this webinar and this event is going to be perfect for you because we're going to talk through all the things that you need to do between now and all the way up until when you apply to medical school and you get that place at medical school. Feel free to take pictures of any of the slides as well. There's some nice kind of visuals of timelines as well slightly later on, so you can keep those for your records. Just switch back to the slides. So I'll just do a super brief introduction in terms of who we are, who you will be meeting today. So you've already met me. My name is Mark. You'll also be meeting Mo, who is a pediatric teaching fellow. Mo also teaches on our GP Live and our Ward Round Live courses as well. So he helps a lot of students with medical work experience, and he's a fantastic teacher. We've also got Finn and Flora as well, who are fourth year or just going into their final year of medical school at Newcastle University. Everyone will introduce themselves in a bit more detail when it's their kind of section. But we have a really good mixture of medical students who have been through the process that you have been through, and a fantastic doctor who helps students with work experience and key elements of applying to medical school as well. And you'll be able to ask all those guys lots of questions at the end, and the Q&A will be open. We'll try and get all three in here, and you can ask any of them questions throughout or towards the end of the session as well. So this is just the timetable as well, just to give you a bit of a breakdown of what's happening. So welcome and introductions, 15 minutes. And then we're going to be looking at the applying to medical school timeline, and we're just going to break down exactly what you're going to go through and the process that you're going to go through over the next 18 months. We'll have a quick 10-minute break. And then the middle section is going to be all about work experience. So deciding whether medicine is right for you, the importance of work experience, and we'll actually have a live GP scenario that is going to happen in our studio. So you'll be able to watch a GP take a full patient history, and then you're actually going to discuss what you think is wrong with the patient with Mo slightly later on. We'll have another break after that, and then we are going to have a bit of a talk about balancing school whilst applying to medical school. I think it's really important that you have an awareness and of how much you have to do over the next 18 months. And it can be hard to balance that sometimes with the amount of schoolwork that you have. So it's just how you're going to deal with some of those challenges and how you're going to deal with that workload over the next 18 months. And you'll actually hear from students who have been through that process and had to manage that, so they can give you their experience. Then finally, we'll recap with what you'll need to do in this year. So we'll break down the things you need to do in the short term. And then we'll have a Q&A at the end where you can ask all the questions that you would like asked. Okay. So this is the time when I'm going to step out of the way, and the next people you're going to see here are going to be Finn and Flora, and they're going to be talking through the timeline of applying to medical school. So we're going to run a little video, and then the next people you see will be Finn and Flora, who will introduce themselves, and they will talk through this topic for you. Okay, I'll be back slightly later on. I'll see you later.
Hi guys, how are you all doing? I'm Flora, I'm a fourth year medical student and I'm going into my 5th year at Newcastle University.
And I'm Finn, and I'm also going into my 5th year at Newcastle University as well.
So basically in the next 45 minutes or so, what we're going to do is go through the timeline of applying to medical school, a bit about my own timeline and Finn's timeline as well, and then obviously getting past medical school, the timeline of actually being a doctor. And if you have any questions, put them in the Q&A, but we're going to do a Q&A at the end of the day, so hopefully we can cover your questions in more detail. So this is just kind of talking about the timeline of year 11. So most of you will have already done all of these things, but I'll recap them. So in January of year 11, you would have chosen your A-levels or equivalent, and broadly speaking, most will want you to take chemistry and biology and one other subject. I've seen a few questions in the Q&A asking about kind of what the last subject should be, or whether you should take 4 subjects. And I think it completely depends on you. I personally did biology, chemistry, maths A-level, but when I did it, there was ASs, so I dropped AS physics. So I did biology, chemistry, and maths. But my personal advice, I'm not sure what yours is, Finn, would be probably to take the A-level that you're best at for your 3rd subject. And that's just because all medical universities will need 3 A's essentially. So you want to take the subject that you're most likely to get an A in, but also take a subject you enjoy. Biology and chemistry are hard A-levels. So if there's something you really, really enjoy and you're really good at, then that should be your 3rd A-level. And universities don't really care what the 3rd A-level is. So don't kind of worry too much about that. I hope I've answered your questions a bit about that. And then in kind of June, September, summertime, you will have sat your GCSEs, you guys will have got your results. In terms of GCSE grades, what I would personally say is most universities don't put too much emphasis on this. I know some do. I applied for Edinburgh and they do look at your GCSE grades, but the majority don't focus too much on it. There's a lot more important parts to the application, which we'll go through a bit more. So you guys have got your GCSE grades and you'll be starting a new 6th form maybe, or starting new subjects. And yeah, this is essentially where you are now.
So moving into year 12, there's going to be a lot of different things that you're going to have to start thinking about. To start off with, you need to start thinking about gaining some work experience and some volunteering as well. So over this summer period, it's really good to start thinking about that now, kind of getting it in as early as possible so there isn't that stress later on. You can do a range of work experience from, going in and sitting in a GP or in a hospital, although that can be a lot harder around this time with COVID. So don't worry about it too much. Volunteering is also very useful, gives you something to talk about in your interviews or in your personal statement, and really showing that you have the commitment and kind of proving different skills as well for why you would be good and suited to medicine. Also, with all of these kind of experiences that you're going to be getting, it's very useful to keep a diary, so that you can write down what you've learned, and what sort of experiences you may have had, and how that might have allowed you to gain a better insight into medical practice, and really solidified why you want to become a doctor. With all of those sorts of things, there's also other bits that you need to be thinking about. So later on, as we get to June time, you're going to start thinking about entrance exams for medicine, such as the UCAT. So most people book it in June, for later on in July to September time. And you want to make sure that you're leaving enough time to learn how to take this exam and really have enough time to practice properly, because it is quite important for a lot of different universities, but we'll touch on that a bit more later. And then in the summer of year 12, you'll also be trying to get as much more work experience as you can, just touching up those little bits for your personal statement so you can talk about a lot.
Okay, and moving on to year 13, which I know might seem miles away for you guys right now. So after you'll have sat your UCAT in the summer of year 12, you'll be back in September and you'll have started drafting your personal statements and really finalising them. And in September, if you decide to book the VMAT, that is when it needs to be booked. And that depends on if you're wanting to apply to VMAT universities, or maybe if you haven't done as well as you'd liked in your UCAT, that's when you need to apply. And in September, you also need to decide on your 4 medical schools. There's a lot to weigh up when it comes to deciding which med school is right for you. And I would advise that not only do you look at the medical school, the teaching style, also look at the university as a whole. So looking at the social life, the societies, accommodation, for example. And again, looking at the requirements, looking at the grade requirements, because they're different, looking at how they emphasize the UCAT and VMAT process as well. So in October, you'll have finished your personal statement, you'll have your UCAT score, you'll have a reference from the school, you'll have your academic kind of reference with your predicted grades, and the 15th of October is your application to medical school deadline. So everything needs to be finalised by then. It's a bit different when you're applying to medicine compared to maybe your friends who are applying to other courses, because their deadlines are usually in January. So you will find that you are quite tightly packed to do things in the first 2 months of year 13. We will touch on this a bit later, but it's important to know you can only apply to 4 medical schools, but you get 5 applications in total. So you can apply to another degree that's non-medicine related, and that application doesn't necessarily need to be done by October. So in November, if you choose to sit the VMAT, then that's when you'd sit the VMAT. But it's important to note you won't have your VMAT score kind of when you apply, so you won't know how you'll have done in that. And November to March time is when you would do your medical school interviews. So what they would normally do is kind of email you saying you've been successful, you've got an interview, and obviously if you haven't heard back from them by March, then you've been unsuccessful with getting an interview, so kind of your application won't progress. I'll touch a bit on interviews for any of you that have questions later on, but there's different styles of interviews. All of my interviews were MMI. So essentially you rotate around in a circuit, and there's kind of like 7 stations, for example, and each station would be 7 minutes. So that's kind of how it worked at the universities I applied to. But let's say a university like Oxbridge, they do panel interviews. So that's one-on-one kind of interview for maybe like 40 minutes. But it's important to note, just because it kind of affects the way that you revise or maybe practice questions. And then in August, you have your A-level results day. You'll find out the results you get. And generally speaking, all offers from medicine are 3 A's, or maybe an A-star AA, it could be higher. And if you don't receive the results you were hoping for, it's not the end of the world. Not everyone gets into medicine first time. You can look into clearing, but it's very, very rare that you would find a clearing place for medicine. A lot of people do their fifth choice, so whether that's biomed, for example, which often has lower grade requirements, and then choose to maybe do a year of biomed and reapply for medicine, for example. So the route to medicine isn't always straightforward, but it's just how it is.
Yeah, so this is just the key dates that we've been talking about before. So obviously you've already done, for most of you at least, all of this stuff in year 11. So choosing the A levels that you're going to do, thinking about work experience now in August, trying to get that organised for next year or even as soon as possible. And you've already had your results day, so you should know what A levels you will be doing. Then obviously next year, keep on studying, study hard. Grades are really important for medicine, and keep on track. Make sure that your grades are consistent throughout the year. And from September onwards, you want to be gaining some regular work experience or volunteering, kind of showing some commitment. And then later on, when we get into June and July, you're going to be booking your UCAT and revising for that and making sure that that's all up to scratch. So then when you take it in July to September time, you're fully prepared. And then in August, you'll be doing starting your application. So your personal statement, you want to be starting that, or at least starting to think about it. And then in year 13, if you're doing the VMAT, you'll have to book that. You also have to choose the medical schools that you will want to go to, listing them, and sending off your personal statement in October. The 15th of October is the last date to submit that for medicine. Then moving on into November, you'll be sitting the BMAT if you're doing that for the universities you've applied to. And then hopefully you'll be getting some medical school interviews between November and April. And then finally, you'll be doing your exams and getting your A-level results in August.
So I'm just going to talk about my personal timeline and kind of my application to med school. So my GP placement, I had one in year 10. I was quite lucky just because I knew some doctors from my school. So I was able to get that quite easily organised. And then I did 2 hospital placements, and those were in year 12. And I also did some volunteering as well. So that was part of my kind of bronze and gold Duke of Edinburgh. So I did it in a food kitchen, at a church. And it wasn't every week, it was kind of every few months, but that's fine as long as you kind of have something to reflect from it and learn from. So I did my UCAT at the start of September. I chose to do it a bit later just because I wanted the time to revise over summer, but I think it depends on everyone really, what time you think's best for you. And I got an average of 760. And I mean, I was quite happy with the score. I didn't really want to go to any BMAT unis, but I was happy enough with my score that I didn't feel like I needed to do the BMAT. So then in October, I applied to 4 universities for medicine. So that's Newcastle, Edinburgh, Manchester, and Liverpool. And I did my 5th choice for biomed at Newcastle. Again, that was just a backup. It wasn't something I necessarily wanted to do, but I kind of wanted to make sure that I did have a backup in case I didn't get the grades. And I got interviews for all of them. But when I applied, my year was the last year where Edinburgh didn't apply. So from applying in October, you didn't hear back from them till March. And Edinburgh used to, but kind of still do, put a lot of emphasis on things like your grades, your predicted grades, your personal statement, your UCAT score, and they would rank that against everyone else. So theirs was a bit more academic. But all of the other universities gave me an interview. My first interview was Newcastle. That was in December. And that was the MMI style that I talked about. So where you rotate around in a circuit. And then I had Liverpool and Manchester at literally the same weeks. They got in touch with me back to back, really, and that was in February. The sort of questions that they kind of asked for interview, if you guys like haven't looked at it already, even though it's a bit further away, things like, first at Newcastle, they asked, why do you want to be a doctor, as like a warm-up question, and it should be a question that everyone's kind of like practiced. They almost always ask an ethics question. So at Newcastle, they were asking, like, talk about an ethical scenario you've read about or seen on the news recently. I know at Manchester, they gave a newspaper of an ethical scenario and told me to like read it and debate about it. They almost always have questions on your kind of extracurricular, and they tend to ask questions as well, like, tell me about a time that you had to show endurance or some kind of showed resilience. So it's a lot about yourself and personal skills, and they do want you to have a good grasp of the curriculum, the university as well. So Newcastle asked about the course structure, how the kind of course is delivered and things like that. And so I got my offers in March, and I got 4 offers. I got my offer for biomed as well. And all of the offers for medicine were 3As. I think biomed might have been ABB off the top of my head. And in March, you have to basically rank a first and second choice. And I chose to do Newcastle as my first choice, and I did Liverpool as my second choice, which is a bit strange because they both had the same grade requirements. But my sister went to Liverpool for medicine, and she told me that a few people there had got kind of lower grades, and I think it kind of like persuaded me more. But again, most people would probably put their 5th choice as their second choice. So yeah, and then did my A levels, and on results day I got A star AA, which I was happy with. It was the results I needed, so I got into my first choice, which was Newcastle, and I'm here now. So I'm in my, like I said, I've just finished my 4th year. I chose not to intercalate, so I've been here 4 years now, and I'm going into my final year, and I really love it. So it definitely was the right decision for me.
Yeah, so this is my timeline. It's fairly similar to Flora's, but there is a few differences. So I was looking for GP and hospital placements in year 12 and 13, and it was actually quite hard for me. I sent in about 7 letters maybe to different GPs around my area, but none of them got back to me. So I then had to go in person with the letters, handing them into the reception staff. And I think after applying to about 10 in all, so walk in for 3 and sent in letters for 7, I managed to get a couple of days in a GP. Hospital placement, I got that through my school. So that's also something that a lot of you guys can ask for. If you ask your school, they might have links with the local hospital, and that might be helpful. Because I found it so hard to get those placements, I did a lot of volunteering. So for about 2 years, I volunteered twice a week in a care home for about 3 hours each day, so 6 hours per week. And I learned a lot from that. And it was quite a good experience, especially for interviews. It gave me a lot to talk about and showed skills that I wanted to prove, basically. With the UCAT, or the UCAT for you guys now, I sat that in August, and I got an average of 730, which I was very happy with. So that allowed me to apply to 4 different medical schools. So I applied to Newcastle, Keele, Leicester and Manchester, and also chemistry at Leicester as my 5th choice. I managed to get interviews for Newcastle, Keele and Manchester, and I received those 3 offers in March, as well as chemistry at Leicester. And then going forward from that, I received AAA at A level, so that allowed me to get into Newcastle, and I've been there ever since. The only other thing that I did want to mention is that with the UCAT, it can be quite stressful, and some of the topics within you might find particularly tricky. I've got dyslexia, so I found the reading portion of that quite tricky. But you do get 25% extra time if you get that in school anyway. So make sure you apply for that before you go to the test, and just make sure that you really practice the bits that you find the most tricky.
So what I'm going to talk about next is just about kind of how many applications you get. I know I've mentioned it a bit briefly earlier. So you have 5 applications in total, but you can only apply to 4 medical schools. So the final application is kind of an application that people use as a backup, and generally speaking, it has lower grade requirements than medicine, which is usually 3 A's or higher. So it allows you to have that backup if you don't get the required grades on results day. Again, this is just saying my kind of choices were Newcastle, Manchester, Edinburgh, Liverpool, and I did biomedicine for Newcastle. Finn did Newcastle, Manchester, Keele, Leicester, and then he chose to do chemistry in Leicester. So it's entirely up to you. I think it's beneficial to do a 5th choice. You don't really lose anything from doing it, and it's not kind of hard work to have that extra application. But that's my personal recommendation.
Yeah, so going on to work experience. Work experience is really important for your application to medical school. It's one of those things that the medical school looks at, and it can allow you to stand out from other people, especially if you've done something over a long period of time and can prove that you've learned something from those experiences. Right now, traditional kind of work experience in the hospital or the GP can be quite hard to get. So medical schools aren't using it as much. So it's no longer essential. If you can get it, that's useful, but don't worry if you can't because of COVID. So alternatives is volunteering, online work experience, and research projects. So with volunteering, obviously, if it's in some sort of medical or care setting, that's the most useful, and it will be a lot easier for you to equate that across and use that within your personal statement or within interviews without too much effort. Online work experience can be also really useful, especially with COVID, and you're not being able to go in to these hospitals or GP surgeries, but having it online obviously makes it safe for the patient, but it also allows you to learn from some experiences and maybe get some experiences that you wouldn't normally get anyway. Research projects is another thing you can do. So it's one of those things that can be quite hard to get into, but there's a lot of things on the internet. If you just email some people that are doing some research, just saying, I'm here, I can do basically anything that you need help with. This is kind of what experience I've had before. It may take a long time to kind of get some replies from that, and you might have to email a lot of different people, but it is another option. So with the work experience, to prove that you've kind of learned something from it and gained an insight, you really want to be reflecting. So all of these experiences, if possible, should really be people focused. As a doctor, you're going to be very patient focused in your work and in your career. So kind of getting that early basis of being very people focused in your volunteering and work experience can be really useful. And if that's not you talking to the patients or the people themselves, just learning from other people and those experiences can be very useful. Having a range of different work experiences and volunteering gives you an insight into medical care or just care setting. So it doesn't matter if you're following around a doctor or a nurse or just care staff in a old people's or retirement home. It can also all be very useful. It also allows you to test some skills that may be needed when you become a doctor. And so you can then talk about that later on and prove that you have those skills basically through those experiences.
I just want to add as well about work experience, because some people kind of want to know, I suppose, how much work experience do you need to do? And honestly, I think just get the best amount you can. I think the advantage to having more work experience is that you're more likely to see something meaningful or learn something from it. And then that makes it easier for you to think of an example to write on your personal statement or talk about an interview that you can reflect on. But truthfully, when it comes to kind of writing a personal statement, a lot of people just say, like, I spent some time in a GP, or like I spent some time in hospital, or like they kind of phrase it like in hospital I saw. So they don't actually tend to ask how much you spent. And this is linking into kind of volunteering. Like mine was kind of, I think I did one at Christmas and one at Easter, but when I'm asked questions on it, like no one asked me how often it was or whether it was weekly. They just asked me what I'd learned from it. So don't stress too much if you can't get a lot of work experience. It's what you've taken from it, really. So I'm going to go through a bit about the UCAT and the VMAT, which are quite kind of scary terms, I'm sure, if you don't know what they are. And they're really medicine specific and kind of like dentistry as well. But essentially, the UCAT stands for your UK Clinical Aptitude Test, and it's a 2-hour computer-based exam. Mine was in the same centre that my kind of driving theory was, so it's kind of like that setup. And it's generally from the July to September of year 12. And it is quite an important exam because 30 medical schools require this. So it really is the majority of med schools, at least look at UCAT partly. And the UCAT's made up of 5 sections. So you have your verbal reasoning, and essentially you get these passages of text and you're under time conditions, and they'll ask you more questions about the text. You have your decision making. So that was in a section when I did it. But it's a bit about, you kind of get pictures of Venn diagrams and again, passages of text, and you have to make a certain decision saying which statement's true, depending on what they've given you. You have your quantitative reasoning. So that's your kind of quick sums and maths. It's really testing kind of GCSE maths and maybe A-level if any of you guys are doing it. So for me, I found that the easiest. And then you have your abstract reasoning. So that's looking at shapes, patterns of shapes. And for me, that was probably the most alien section of it. I don't think it's something you really do outside of the UCAT. And then lastly, you have your situational judgment. So that section's done in bands. So band 1, 2, 3, 4, with 1 and 2 being the best. Generally, med school want you to get a band 1 or a band 2, but it's not as heavily weighted as the other sections. And then you have your BMAT. So that's your biomedical aptitude test. It's a 2-hour exam again, and it's computer-based. However, this time it's tested in November. So this is after you'll have applied for your med schools in October. And 8 medical schools require this. And the next slide is going to show you which ones do. But that's made up of 3 sections. You have the thinking skills, which is your verbal and numerical reasoning. That first section is very similar to the UCAT. It's very similar to like the verbal and quantitative reasoning aspects of the UCAT. And then you have your scientific knowledge and application. So that's focusing more on your GCSE science and maybe a bit of A-level. So it is definitely an advantage to be doing science A-level, but again, the majority of people who are doing medicine will be doing that. And then lastly, you have your writing task. So that's like a half an hour short essay. I didn't personally sit the BMAT. I know a lot of people who do. I think if you obviously want to apply to BMAT uni, then you'll have to sit the BMAT. I know a lot of people who sat the BMAT because they weren't very happy with their UCAT, and it almost is like a backup if you don't do well in your UCAT. But again, some people do both as well, if again, they want to go to BMAT uni. So it depends on you really.
One thing I just want to add in there quickly, with the UCAT, it can be quite hard, but it's more about timing. So it's very much, you feel that you're rushed with a lot of the maths questions and quantitative reasoning, with abstract reasoning as well, and situational judgment and such. It's not that the questions are really, really hard if you had the time, but it's more about making quick decisions and just trying to get as many marks as you possibly can. So it's really about the practice.
And again, yeah, touching on the UCAT, a lot of the kind of like the quantitative reasoning, for example, I found a bit easier because I was doing maths A level, but the verbal reasoning, like I found really hard. And we'll talk a bit more about kind of revising for the UCAT, but it's really important that you kind of work the most at what you're not as good at. And I can still remember questions for abstract reasoning. Like I'll give you an example. So kind of the questions you would get was, we had these, let's say one box had like 4 triangles, the next had 3, the next had 2, then you'd be able to kind of know the pattern. But some of the sequences they give you in the abstract are really rogue. Like I remember I had one on like the Fibonacci sequence and stuff. And I think for me, that isn't something that comes naturally to recognize that pattern. And I think that's why it's really important when you're doing the UCAT to keep doing practice questions and keep doing practice exams as well under timed conditions, because it's the time that kind of like stops you from performing well. Yeah.
So as we said before, most of the medical schools require you to do the UCAT, but there are these universities that use the BMAT instead. So Brighton and Sussex Medical School, the University of Cambridge, Imperial College London, Lancaster University, the University of Leeds, the University of Oxford, and University College London, they all require the BMAT instead of the UCAT. So when applying to these or any of the medical schools, you really need to make sure that you're doing the right exam for that university. And there's a link there that we put in chat for some free resources.
Okay, so for those of you who don't know about what a personal statement is or kind of how to write it, essentially a personal statement is part of your UCAT application, your UCAS application, and it's like 500 words text, and it's your chance to basically showcase any skills and qualities. And you really want to be highlighting your motivation to do medicine. So why do you want to be a doctor? And you want to explore that in a bit more detail. So what have you done to show that you want to be a doctor? And that's talking about things like work experience. And then lastly, you want to be touching on your suitability for medicine. So have you got any skills that's going to be required of a doctor? And if so, how have you kind of showcased that? And that's using your reflections. And the next slide is talking kind of about what it should include, but the general structure is you have an introduction that will show your motivation. Then you'll talk about your work experience, your extracurricular, your volunteering, and within that is all reflections and kind of showing what skills you've seen and skills you've kind of learned and how that relates to a doctor. And then you'll finish with a conclusion. Again, that's showing your motivation for medicine. So why do you want to be a doctor? And I think the advice that I would give your personal statement is try to start it as early as you can. Obviously, don't let it kind of take over your UCAT revision, but definitely start drafting it in the summer of year 12 and try and get as many people as you can to read it, whether that's school, your friends, your family. Some people have personal statement tutors, but I didn't, and you don't need to, as long as many people as you can get to see it.
And I was just going to say with that as well, is that 500 words may seem like a lot, but I know when I was writing mine, it started off at kind of like 2.5 pages because there's so many skills that you want to get across and you will have to condense it down. And what you really want to have is each sentence having portrayed some sort of skill or something that you want to tell the med school of why you'd be a good fit. You don't want kind of any empty space or just kind of filling in the gaps. You want everything to be useful in that personal statement.
Yeah, I agree. You can't have any filler sentences, and you write this draft in kind of August time or maybe September, but really the majority of September and October is cutting down the personal statement. You probably would have written the bulk of it already by September. And exactly like Finn said, every sentence needs to contribute towards something. And I would also say just making sure that you're really personal to yourself, because they're going to read kind of thousands and thousands of applications a year. And I know it's easy to kind of maybe look at a personal statement and see what other people have written, but you've got to think they're reading so many of these a year. So you need to talk about experiences like work experience, volunteering, that makes you stand out.
So with the next bit, what sort of things should you include in your personal statement? So this is kind of like a rough guide, but as Flora was just saying, you do want to stand out. So most people will be including these bits in there, and you really want to be fleshing out the kind of work experience and volunteering the most to make you stand out. Most people always start with a sentence or two saying why they want to be a doctor or why that interests them. And then they go on to work experience and what they've learned from that and volunteering. And as we've kind of said before, the work experience and volunteering is probably the most important part of the personal statement. It allows you to stand out. It allows you to show skills that you want to portray, and basically shows why you would be a good fit for medicine and to become a doctor. You can also put in some wider reading. So if there's anything that you're particularly interested in within medicine that you've read, research papers, books, you can put this in. But as I said, when you're kind of writing this, it's quite hard to get everything in. So don't worry if you don't get all of these different points in. And then to finish off with extracurriculars and a conclusion. So extracurriculars are really important as well. It needs to show that you're not just academic, because medicine can be really stressful. There's exams constantly. And if you don't really want to be there, it can be quite hard. So showing that you've got extracurriculars, whether that be sports, hobbies, or like music, it can be really useful to show that you're more well-rounded and more resilient under stressful conditions. And then you want to be wrapping up with a conclusion, just kind of saying that this is all of the things I've shown you, and this is why I would be a good fit at your university.
Yeah, and touching again on extracurricular, I know I put like my musical instruments and stuff. You need to remember that things like that show dedication as well. So if you've got to a certain grade in a musical instrument, for example, put that in, because it just shows that you have the dedication. And like things like instruments, for example, they take years to kind of get better at, and it's really similar to medicine in that respect.
Yeah, and that's the same with any sort of sports as well. So if you've been part of a Sunday football club, or you did gymnastics for many years, that also shows dedication and that you're willing to stick to something and get better at it. So anything that you've stuck to for a long period of time can be used in that situation.
Okay, so what happens after medical school? We've just got a free resource there. It's just talking a bit more about the timeline of being a doctor, but we'll cover that as well. So I'm going to get Mark to put the next poll up, but the question is, how long do you guys think it takes to become a GP? And that's including medical school and assuming that no gap years have been taken. So this is assuming that from when you're 18 to however long it takes. Okay, I feel like we've got one answer that stands out the most. So most people have put 10 years, and that would be correct. So you have your 5 years of medical school. Obviously, some universities are 6, but the majority are 5. Then you have your 2 years of foundation training, and then you have 3 years of GP training. So it's scary to think that kind of from year 13 in 10 years time, you guys could be kind of fully fledged GPs, kind of with your own patients, and kind of independently practicing. So it's a really scary thought. And if you put it in that perspective, it really does fly by.
Okay, so this is kind of just getting you an understanding of the timeline to become a doctor. So for most of you, you've already done your GCSEs, you've decided on what sixth form or college you're going to and what subjects you want to do, and hopefully starting to think about getting some work experience in. Through AS year, you'll obviously be doing that work experience and some volunteering, hopefully. And then you'll be starting to think about uni choices, whether you're going to be taking the VMAT and the UCAT or just one of them. Hopefully continuing with the work experience or volunteering, and then starting on your personal statement and getting ready for interviews in year 13. Then having done your A-levels in year 13 and getting your grades, hopefully, you can either obviously go straight into med school or through deferral or gap year in between. There are some courses that have foundation years or pre-med years, and that depends on kind of the course you're looking at. Once you're in med school, most medical schools are split into 2 years of non-clinical. So that's generally lecture-based and seminars. Some medical schools will have a little bit of practice mixed in, just a kind of taster, but it will mostly be learning the basics of medicine. And then you have 3 years of clinical practice. So that will be 3rd, 4th, and 5th year. And that's moving from lecture-based into applying that within a care setting, so within a hospital or a GP, and really getting to terms with making sure that you can take history, get the right information, do exams on patients that aren't normal. So obviously in first year, you'll have that practice, but it will be on people that don't have anything wrong with them. So coming into the hospital, you'll be doing these exams and histories on people that do actually have things wrong with them. So you want to be getting all of the information out of them possible, and then moving on through into 4th and 5th year, you'll start to make decisions about how you think their care should be handled, and that will be talked through with the doctor. And it's really getting practice ready to start your foundation years. Then you have your foundation years after medical school, so that's FY1 and FY2, and you'll be on different rotations, work in different settings depending on kind of where you are placed and what hospital. After that, you can do an additional FY3, and that can allow you to get more learning or have some teaching practice, so teaching younger years. And that can be really useful, or just if that's something that you enjoy, it can be something to do there as well. Then you move on to your specialty. So specialty training can take a range of time. Lowest is GP, as we said, and that's just the 3 years after all of med school and your foundation years. But that can go all the way up to kind of 8 to 10 years, depending on certain surgical specialties as well.
So that's kind of the first part done. We're going to have a 10-minute break, and then we have Dr. Mo coming on afterwards, which is very exciting. So we'll probably go off now, but we'll be back a bit later, and there's a Q&A at the end as well.
Hi, good afternoon, guys. So my name is Mo. I'm currently a pediatric teaching fellow at Newcastle University, and I also work for medical projects. This is quite a fun and kind of a new thing that I've done, especially with this webinar, talking a little bit about medicine, and hopefully kind of give you a bit of an inspiration and kind of a bit of motivation to get a bit more involved, a bit more stuck in about thinking about medicine, about starting to get prepped, about starting to get things in motion so that hopefully when you come to apply, you feel the most kind of prepared kind of going into it. Let's talk about, we're going to be doing a few things with me. So we're going to talk about, is medicine right for you? We'll then move on and talk a little bit about kind of work experience. And then we'll do a practice run of a patient history. Now, the practice run of the patient history is a bit of a taster of what I kind of usually do on a day-to-day with medical projects, which is mainly kind of GP live and ward round live sessions, which again, we'll kind of come and talk a little bit about when we get to that little bit there. But a little bit about me. So like I said, my name is Mo. I did kind of medicine at Newcastle University. I did it from 2013 to 2018. Before that, I did a clinical sciences course at Bradford University. And that kind of got me to a point where I was thinking, do I want to do clinical sciences or do I want to apply again? And I applied to getting into medicine. I applied kind of 3 times, I think, in total before I eventually got in, with kind of a couple of gap years. So a gap year before my clinical sciences and a gap year after my clinical sciences. So a bit of inspiration to say never give up. If you really want to do it, you just keep striving for it. And then obviously finished my medical degree and stayed in the Northeast. I'm actually from Sheffield, but the Northeast has kind of grabbed me. I did my foundation F1 and F2 at Sunderland, and I've stayed on kind of doing this role. What do I do in my current role? So I'm a teaching fellow. So I teach medical students 3rd, 4th and 5th years pediatrics. But I also do lots of stuff with the university. So I get involved with university interviews for new med students. Last year it was online, but hopefully this year we're trying to get it back into in-person MMIs again. I also do a lot of kind of prep with regards to kind of getting patients for students to see and trying to kind of get a bit more involved with kind of preschool, well, not preschool, pre-university students, see if there's anything that they kind of need assistance or any help with. But kind of the majority of things that we do is around med students or kind of the stuff that when students get into medicine. So let's talk about medicine and if it's right for you. So it's not right for everyone, okay? We all have sometimes this kind of vision that we all want to do medicine, but sometimes our actual perception of medicine, of what it is versus the reality of medicine can be 2 very different things. And it's all about where you got your perception of medicine from. Did you get your perception of medicine from social media or from the from kind of TV shows such as Grey's Anatomy or House or any of that? Or have you got it from family members or from friends or kind of people that you may know? And that kind of makes a big difference. But by doing lots of different things to find out if medicine's right for you, it can bring it close to the reality. So you can get your perception of it very close to reality. So what can you do? You can gain an insight into the role of a doctor. You can find out a bit about the characteristics that are needed to be a doctor. You can find out about what the motivations are for those wanting to go into medicine, but also your own motivations. And then once you found out what's important about being a doctor, you can then see if you will fit that. Do your strengths and weaknesses kind of make it a bit more easy for you to get into medicine? Do your personal traits mean that actually you're a bit more kind of a people's person, you want to help people, you want to care for people, all that, and that naturally comes quite easy to you, and actually that's what you want to do and kind of carry on with that? So again, it's all about sitting down and spending a bit of time thinking about yourself, thinking about reflecting on your strengths, what you're good at, what skills you're good at, what skills that you think might need a bit more kind of help or a bit more kind of bolstering up. And then thinking, again, like I said, about what it means to be a doctor. Now, how do you find out about what it means to be a doctor? Okay. And we'll come on to the next slide about the importance of work experience. And that's one way to find out. But before even getting anywhere near that, there are a lot of online resources that you can find with regards to about being a doctor. Okay. You can find the GMC. The GMC guidelines tell you about tomorrow's doctors, and it tells you about what the skills are, what is needed, and stuff like that. There's also a free resource with a checklist of whether medicine's right for you. And again, you can access that and kind of have a little flick through and kind of see if that fits you. Okay. But that is essentially a very simplistic way of trying to find out if medicine's right for you. But the real best way of finding out if medicine's real for you and seeing the reality for yourself is through work experience. And what we're going to do is we're going to talk about the importance of work experience. And through talking about the importance of work experience, we'll talk a little bit about what it means to be a doctor and what I feel is important skills for you being a doctor. So work experience. What do we mean by work experience? Why is work experience important? And what counts as a work experience? So these are the common questions we get asked, whether it's kind of, I get asked this kind of personally from kind of friends and family who are thinking about getting into medicine, but also in our courses, we always get these kind of questions that kind of prop up. So what do we mean by work experience? So work experience are, like I said, activities that help you prepare to being a medical student, but also eventually being a doctor. Work experience helps you understand and see the realities of being a doctor, and it helps you figure out whether that fits you or not. It is what the words say, so it's an experience of the workplace that you want to go to. It might be important, and it is very important for medicine, but it's not just important for medicine. It's important for any other specialties that you might think about getting into. You might be debating between medicine and dentistry. You might be debating between pharmacy and medicine. You might be debating between medicine and any other specialties. How are you going to really figure out, as a school-aged kind of student, whether medicine is really for you or whether actually the other ones are for you? And through building up your experience by seeing what it is to be in the workplace, by seeing what doctors actually do day to day, by talking to lots of people, it can be really important. So that is essentially why it's so important, because it helps you figure out your future. There's lots of pressure on you to make a lifelong decision about what career you want to get into. And medicine is no easy career to get into. You might think actually it's just med school that you have to learn and develop, but getting into medicine is getting into a lifelong career of learning. Not only learning, but developing yourself, developing your skills, developing your knowledge. It also comes with a lot of responsibility. It comes with a lot of responsibility for caring for patients, for looking after patients, for looking after each other. And it comes obviously with a lot of kind of responsibility of making sure that you're getting the right, working together as a team to get the right diagnosis, to care for people, and making sure that you're doing what is best for patients. And that's why it's really important to get that work experience, to really figure out the ins and outs of medicine. Not only is it important to figure out the ins and outs of medicine and be a doctor later on, it's also really important to figure out the ins and outs of being a medical student. Medical school is 5 years to 6 years, can be 4 years if you do it as a postgrad, can be longer if you end up deciding to do things in between, such as intercalation years, or unfortunately you fail a year, or you take a gap year, or you do things in between. But finding out about what it is to be a medical student is just as important as finding out what it is to be a doctor, because 5 years of med school is quite intense. It's quite long. It's quite heavy. So you need to make sure that you're dedicated enough to get into it. What counts as work experience? So historically, the traditional work experience we've heard of is kind of talking about kind of going into a GP practice, going into a hospital, shadowing some doctors, going into kind of hospices. But that is just kind of one element of work experience. There are so many different elements of work experience when you're thinking about medicine. Now with COVID, we've had to think outside the box, and we've had to really work, kind of figure out a different way of getting work experience, because actually GP practices, hospitals, they've all closed up for extra people. So you can't actually get, or couldn't actually get work experience from hospitals or from GPs during COVID. Now that is getting slightly relaxed now, with obviously with COVID, thankfully easing a little bit. But again, it differs from hospital and from GP to GP. So what other work experience can you get? You can get some courses, so you can do live courses, and that helps you figure out from speaking to real doctors and speaking to real med students. You can sit down with doctors who might be family friends or who might be friends of friends, again, getting a bit of a real life experience of what it is to be a doctor. There are other things you can do. You can also then start thinking about, okay, what about my extracurricular activities? Are they kind of things that I can develop communication skills or team working skills or skills that are important for being a doctor? And I can show that that is actually very much linked. That is just as important. Getting paid work or unpaid work. I know there's a question that popped up asking if you've got paid work, whether that counts as experience. Absolutely. Because during paid work or unpaid work, so during volunteering, if you volunteer in a care home or you volunteer in a hospice or in a charity shop, they are all really, really key, because they all help you develop really important skills. And these are skills that I want you to show off when you come to do your interviews. I want you to show to me, yes, I know it's important as a doctor to communicate, to be honest, to speak together with a team to figure out what's going on. Yes, it's important to know that. But have you shown me that you have taken steps to try and develop that before getting in med school? And that can be really important, and that can help separate you from kind of any other interviewees. How do I get work experience? $1 million question. Prep work, don't leave it till last minute, be organized, be persistent, and that is key. You can send emails, make phone calls. We've got a kind of an email template and a call script, which again are available for free. And these are resources that help you kind of when you come later on in time to think, okay, actually, I need a bit of a guide to think about how to send an email. It's quite nerve-wracking to send an email to someone asking them if you can come and do some work experience. Every hospital will have kind of either a kind of an education lead or kind of a HR lead who you can contact, and there will always be someone who's in charge of work experience students. Try and find out who that person is. You can sometimes either find it out from people who've done it before, from forums online, or even from just contacting the hospital. Find out who they are, try and contact them, try and speak to them, send an email, do a telephone call. Any experience is better than no experience. So even if you're really keen and say you want to be a surgeon thanks to Grey's Anatomy, fine, it might be really important for you to get that surgical experience. But actually, if they offer you experience in obs-and-gynae or pediatrics, that's fine. You can go down that route and kind of try and figure out going in that and figure out what it's like to be just kind of a doctor, okay? Every experience is an experience, and you can use it to sell yourself again and again. Friends and family. Now, some people are very lucky and they have parents who might be doctors. They might have family friends who might be doctors. Use them, okay? Use them to get into hospitals, use them to get into GP practices, use them to try and get that bit more experience from them. If you don't have a friend or family or a close friend or family that might be a doctor, again, there might be a family doctor that you go and see. So there's a GP that your parents have been that your whole family goes and sees. Maybe try and contact them, okay? Or you might have a friend of a friend that might be a doctor. Try and again go through that. Being persistent and trying to use lots of different methods of getting work experience will pay off, and you will be able to eventually get work experience. Just because you get one work experience, just because one GP practice says yes, keep going, okay? Try and get more experience. Try and get a wide variety of experience. Now, if you can't get any work experience and you can't go into hospital, you can't get into GP, that's absolutely fine. Not everyone I've interviewed last year has been able to obviously get into GP or into hospital, but they've shown me what they've done to try and negate that, to try and find different ways of working through that, okay? And so what we're going to do is we're going to talk about kind of patience. We're going to talk about a bit about kind of reflection. And like I said, we're going to then take ourselves into a patient discussion. So patient experiences. So we've got well, what we're going to do is we've got a patient here who who is an actor, so they're not actually got the real life condition, but they will be the patient emulating kind of having a real life condition. I will be the doctor as that is my role, and I'll be taking a history from a patient, okay? Now, this is a bit of a taster to what we offer kind of in medical projects with regards to trying to get you stuck in and seeing what it's like being a doctor without having to get into a hospital or a GP, because we obviously know how difficult that's been in the last year and how difficult it's going to continue to be, okay? Getting to meet, getting to speak to patients, getting to ask them questions is usually one of the best ways of getting work experience, because it's a role that a doctor has to do day in, day out, okay? You speak to a kind of a large volume of patients when you're as a med student, but you also do it every day when you're a doctor. And so getting that experience, getting that understanding of how it is to speak to a patient, how to interact to a patient can really be quite valuable. Like I said before, we offer different resources and medical projects. So we've got Ward Round Live, we've got GP Live, and they're really good online sessions where we start off very much like this, talking about the fundamentals of taking a history, talking about the fundamentals of what it takes to be a good doctor, what it takes, what skills you think is important to be a doctor. And through that, we can then develop a bit about your communication skills. We then get you to watch me or kind of any of the other leads take a history, and we get you to critique that. We get you to say what went well, what went poorly, how you thought it can be improved. And once you've critiqued it, then we give you guys the chance to take your own histories. We've got lots of different conditions, so we explore lots of different conditions from chest infections to surgical kind of post-op patients, to mental health patients with kind of low mood. So we explore lots of different patients. And through that, you get an experience of speaking to what could feel sometimes quite challenging patients, but also speaking to patients who are kind of giving you lots of information about what's going on. We get you all to kind of ask questions. We get you all very much involved, and we finish off, and we still finish off with kind of a reflection at the end. So what we're going to do is we're going to give you a little taster of that, okay? And we're going to take a snippet out of the GP Live kind of sessions that we do. Like I said, a GP live session is usually a full day session where we kind of work through it. But we're going to take it to our GP set, and we're going to take one patient history together, and we're going to explore that and see the importance of kind of the history. We'll talk a little bit about what questions were asked. We'll talk a little bit about kind of what conditions you might think is going on, what the next step of investigations we'd do, and what type of management we'd like to do for this type of patient. Okay. So without any further ado, we will move on to our next set, and we'll talk to you about, you'll watch me take a history from our patient and try and find out a bit about what's going on. Okay, so we'll see you back in a couple of seconds once we've moved on to talk to our patient. See you in a bit. Hello there.
Hello.
So my name's Mo. I'm one of the doctors kind of in this GP practice. That sounds like a bit of a nasty cough going on there.
Yeah, it is.
Oh, bless. So can I start off by asking what your name is, please?
My name's Charlie.
Charlie. Okay, lovely to meet you, Charlie. And how old are you, Charlie?
I'm 50.
50?
52.
52, okay. So it sounds like you got pretty nasty cough, but do you want to start us from the beginning and tell us a bit about what's been going on?
Man, it happened about a week ago. I've started getting shivers. I've got a really bad fever. And when I cough, a load of green and yellow phlegm sometimes comes up.
Oh, bless.
Yeah, it's not nice.
No. So there seems to be quite a few things going on. We're going to break it up, okay? We'll talk a little bit about what happened at the beginning, and then we'll kind of explore all the different symptoms. So you said it started a week ago, is that right?
Yeah.
Okay. And what would you say kind of the first symptoms were that started at that time?
Well, I just started coughing a tiny bit. I didn't think of anything of it, and then obviously it started going on. I started getting shivers and a bit of a fever, and then like every morning I would cough and like phlegm would come up, like I said, green and yellow. And obviously I've got the sniffles now as well, and a runny nose. Yeah.
So you're coughing. Let's start with that first. So that started a week ago.
Mm-hmm.
Would you say it's been getting worse, stayed the same, or been getting a bit better?
Progressively worse.
Progressively worse, okay. And you said that you've been bringing up green phlegm. When did that start?
About a few days ago.
A few days ago,
Mm-hmm.
okay. And was it just clear phlegm before that, or was it quite dry?
I wouldn't say it was just like clear phlegm, and
Clear
then
phlegm.
like yellow.
Do you notice any blood in it at all?
No.
No, okay, fine. And you said you started getting some temperatures, is that right?
Yeah.
So when did that start? How many years ago?
Yeah, about the same time. Yeah.
About the same time, okay.
Yeah.
And are the temperatures coming down with anything, or are they just kind of staying up?
Yeah, staying relatively the same. Yeah.
Have you measured the temperatures, or just feeling hot to touch?
No, I haven't. No.
You haven't, okay. And have you taken anything for the temperatures?
I know the only type of medication I do take is Ramphil.
Okay,
Yeah.
fine. So you've got your temperature, you've got your coughs, and you've got your temperature. And you said that you've started getting a bit of a runny nose. When did that start?
Pardon?
You started getting a bit of a runny nose. When did that start?
Yeah. That started a few days after the cough.
A few days after the cough as well?
Yeah.
Okay, fine. Have you noticed any other symptoms at all going on? Have you felt short of breath at all?
No. I've been okay that way.
No?
Yeah.
Okay, fine.
Okay.
How would you say your eating and drinking's been?
I've been fine. Sometimes when I'm eating, if I just start coughing again, I just feel like it's still on my chest. But apart from that, it's been okay.
And is this the first time this has happened, or has it happened before?
First time.
This is the first time. Okay. Have you noticed that when you've been waking up, you've been feeling very sweaty, or is that just?
Yeah, that's happened a lot.
And is that happening just in the last week, or has it happened before then as well?
When this came on.
When this came on, okay. Have you noticed any weight loss at all?
No.
No? Okay, fine. And have you noticed any other symptoms? Have you been feeling sickly or vomited at all?
No.
No? You've not had any kind of issues with your waterworks at all?
No.
No? When was the last time you opened your bowels?
This morning.
This morning. And was it normal for you?
Yeah, regular.
Not diarrhea or anything?
No.
No? You've not got any kind of ear pain or throat pain at all?
No, I wouldn't say it hasn't been too bad. No.
It hasn't been too bad. Okay, fine. Do you have any other health conditions?
I've got a very high blood pressure.
High blood pressure.
Mm-hmm.
Okay. And you said you take Ramapril, and that's where your high blood pressure is at. Do you take anything else?
No.
No. Any allergies at all?
No.
No. Okay. Any family history of any chest conditions?
No, not as I know.
No. Okay, fine. So just a few social questions that we ask everyone. Do you live alone at home at the moment?
Yeah, I live alone with my cat.
Okay. And do you currently work?
No, I don't.
You don't work?
No.
Okay. And do you currently smoke any cigarettes?
No smoking. No.
Have you ever smoked?
I've tried it here and there, but
okay. But you've not smoked properly?
No.
Do you drink any alcohol?
I kind of tend to keep off, to be honest. I have a shandy every Christmas. Honestly, That's about it. Yeah.
That's good. It's good. Very well done for kind of not smoking or not drinking.
My kids are all over it. Like,
pardon?
My kids are all over it.
Are they?
Yeah.
Okay. And how many kids do you have?
I have 3.
3. Okay. And has anyone, either them or anyone near you, been unwell recently, or
no, it's just
anyone
been me.
had any coughs or anything?
Yeah, I'm the unlucky one.
You're just the unlucky one.
Yeah.
Oh, bless you. Okay, fine. How would you say kind of these symptoms have made you feel? Kind of, have you been able to still look after yourself and kind of clean and wash and stuff like that?
Yeah. It's I've been okay that way. Yeah.
So it's not kind of stopped you from doing activities of daily living at all.
Apart from coughing
Apart from coughing.
Yeah, every few moments.
And obviously you come into GP. Do you have much of an idea of what's going on?
No, doctor, I don't. I just want some answers, like, because it's just getting a bit irritating.
Yeah, bless.
Yeah.
Okay, and then what's worrying you the most?
Probably is constant fever.
Just the fever?
Stress, yeah. And obviously the cough's not going anywhere, so I just want to know.
It's pretty nasty, isn't it?
What's going on, really? Yeah.
Okay. And like you said, do you just kind of, by coming here, just want to know kind of a bit about what's going on, get a few answers?
Yeah. I just want to know what's going on and how I can get it to go.
Okay, fab. Is there anything else that you think I've missed that you want me to explore before we finish?
I think that's good enough, Doctor, to be honest. Yeah. I say I'd love to know what's going on after this.
Okay. Fab. So what we'll do is I've got a kind of group of friends that we're going to have a little chat about. We're going to try and figure out a bit about what's going on, and then we'll think about kind of what are the investigations we want to do for you. Okay. And then after that, hopefully we'll get a few answers and we can start you on some treatment. And then take it from there. Does that sound okay?
Yeah, cheers. Thank you.
Okay.
That'd be brilliant.
No worries at all.
Awesome.
We'll see you in a bit.
Thank you.
Hi guys. So welcome back. So we've had obviously a little chat to try and figure out a little bit about what's going on and try and find out from the patient a bit about their story, how the story's been kind of going and developing, try and find out a little bit about kind of the different elements of the story so we can piece together the puzzle to try and figure out what's going on. So there are lots of different elements to a patient history. So number one is taking that history, finding out who they are, how old they are makes a big difference, because with age, you have lots of different conditions that affect people of differing ages. Once you find out who they are, then obviously then you're making sure that number one, you've got the right patient, the right records, the right details for the patient, but also you can then refer to him and you know who they are. You also wanted to make sure that you've introduced yourself so that you're there they know who they're talking to, and it's clear to them that they are talking to the doctor to try and figure out a bit about what's going on for them. Then you figure out the story, and that's what a history is. A history is getting the patient's story. Once you finish the patient's story, then you wanted to add on to that any clinical findings. And you do your clinical findings by doing an examination to add on, and again, that adds on extra pieces of puzzle. Once you've done your examination, now with this patient, it sounds very much like a respiratory condition, so something affecting his lungs, and therefore you'd probably want to do a respiratory examination. Once you've added the respiratory examination to your history, you've got a bigger picture of finding out a bit about kind of the puzzle. So now you're a bit clearer as to what's going on with the puzzle. So the next part is you need to find out and keep adding a bit more puzzle pieces. So now you've got your history examination. You are then going to look at that puzzle pieces and you're going to give a little bit of a guess as to what you think that puzzle looks like. At this point, this puzzle looks like different conditions. And that's when you make a list of kind of conditions. And then from there, you can then work out what investigations you need to do to help rule in and rule out different conditions. That should hopefully leave you with what we call a differential diagnosis of not that many conditions. So it gives you maybe an impression of maybe one or two differential diagnoses, and therefore you can then treat whatever condition you think is going on. That will hopefully then help the patient, you help improve the condition that they've got, and they should then hopefully kind of go back to their normal baseline. Okay. And then once you've got that work experience, once you've got that baseline, and once you've kind of got that, once you've got them back to their normal, then they'll be happy and you've kind of obviously treated them and kind of go from there. Now, if they don't get better and they get a little bit worse or they don't develop that well, then you can then go back to your differential diagnosis, your list of the puzzle pieces that you had together, and then try and go down a different route, or you can take another history to get another puzzle built up together. But what we're going to ask you now is we're going to activate the chat box and we're going to ask you, what do you think is going wrong with our patient? Okay. And with that, we can then try and figure out a little bit about that. And we're going to write a few of the answers on, okay? So we're getting some excellent answers coming here. They're flying through. I'm just going through the answers and trying to figure out what other answers everyone's put down. Okay. We have a lot of answers coming in. I think we've pretty much got there. So this is our very big list of conditions that we're thinking is kind of going on. And I wish medicine was this easy and we can actually all work together and find out exactly what's going on with every patient, because with that, straight away, we've got everyone answering with lots of excellent differential diagnosis. So this is what this is. This list here is when we've looked at that puzzle, okay? We've looked at that puzzle, we've kind of tried to figure out what is going on. And by trying to figure out what is going on, we are coming up with a bit of a list as to the kind of different conditions that could be affecting this patient. I think someone's just put. And so all of these, apart from the last one, are kind of respiratory conditions, aren't they? And these are kind of what we think potentially could be causing someone to kind of become quite unwell. So how do we then go from this list? Because as you can see, you've got pneumonia. So pneumonia is most commonly caused by a bacteria, or it could be caused by other things. So you can have kind of fungal pneumonias, etc., etc. But pneumonia is one of the things. Bronchitis, okay, which is the inflammation of your bronchioles. And again, that could be due to kind of viral or bacterial infections. Common cold, COVID, which is obviously the most common thing at the moment. TB, mainly or especially if the patient kind of come back from traveling abroad or get any contact with anyone with TB. Asthma, so if they've got a lifelong history of asthma. Cancer, kind of especially kind of lung cancer or lung mets. COPD, which is kind of a chronic condition affecting those with affecting them with kind of pulmonary disease. And what happens is you can sometimes have acute exacerbations or infective exacerbations. You've got flu, allergy, and heart failure. Okay, and there are lots of different little ones put into it. Cystic fibrosis was also thrown in there. Upper respiratory tract infection, insomnia, depression, pulmonary hypertension. So lots of other different things that could be going on. But how do we figure out what these? Because they're very different. If you've got a patient who comes in with a common cold versus a patient who comes in with cancer, you've got two very different conditions that are going to need very different management. So what you need to do is you need to then start thinking, okay, does this patient's story fit with any of these or not? So we've got the history, okay, from the history, we know they've got no history of asthma. So they've got no history of asthma, so they're less likely to be asthma, okay? They've also got no history of smoking, so it makes COPD much less likely, okay? You've got kind of a recent contact, so potentially you could be kind of COVID. Common cold wouldn't kind of cause you to have very kind of greeny, mucusy kind of production. Allergies, again, wouldn't cause you to have any fevers. TB, you would have a history of travel or a history of, again, in contact with someone. Heart failure, potentially he's got a history of hypertension, but with heart failure, again, you wouldn't get any fevers. Okay, but you have to be very careful and very aware of that. So now you're left with chest infections, bronchitis, COVID, cancer, and flu. Now with cancer, there's been no history of blood in it. There's been no history of weight loss. There's been no history of night sweats before this, and no history of kind of fevers before this episode. So again, this kind of can be put to the back burner a little bit. But we've got these ones, okay? If we do a examination, we can try and figure out a bit about what kind of is happening with that. Now, a few people have said in the chat with regards to mucus, okay? So we've got clear mucus initially. So clear mucus gives you kind of thinking it's more of kind of a bronchitis picture, talking a little bit about kind of a viral infection in kind of bronchitis. COVID and flu give you more dry coughs than any kind of secretory cough, okay? But when you have bronchitis, COVID or flu, your body is already fighting off an infection and therefore makes it more susceptible to developing a secondary pneumonia on the back of that, okay? Or you can get kind of COVID resulting in quite a significant pneumonia. So again, you have to kind of be very wary and very cautious about your pneumonias. So what do we do next? Our next step, okay, so we've obviously discussed all of it. Our next step is to then think about what investigations we do, okay? So this is what we call our differential diagnoses. And then our next step is to think about what investigations we'd want to do. Okay, and if we're thinking about our investigations, we need to think about your bedside. We need to think about our bloods. And we need to think about our radiology. And a few of you have already started throwing a few in there. So bedside wise, number one, we want to do a full examination, which we've already said we'd do. Okay. We also want to do kind of observations, including, most importantly, SATs and respirate. Because this is a respiratory problem, we need to make sure that he's still getting a good amount of oxygen into his lungs, okay? And so by getting a good amount of oxygen into your lungs, then you're making sure that they're still saturating their important organs, i.e. their brain and all the other kind of important organs within the body. If their oxygen levels are below 94%, then obviously we'd need to give them some oxygen, okay? And obviously then we'd need to treat that. But otherwise, observation bedside-wise, these are kind of the initial ones. And then an important one would be a sputum culture. So sputum-wise, he's producing a lot of sputum, so we can send that off to the labs. And by sending it off to the labs, we can then it comes back and tells us if there's any bacteria in it, okay? And that helps us kind of find out a bit about kind of what other infections are going on. And lastly, PCRs, and for flu and COVID. So a PCR, so we can help us find out if it's COVID or flu through doing a kind of a PCR, and then can help us figure that out. Now, bloods and radiology, if you're in the community, which is in this case in the GP practice, you need to decide how unwell this patient is. So this patient is obviously being quite unwell for a week, but you can decide from your observations and your examination if they're that unwell that they need to have bloods and have further radiology. Now, if you're happy enough that actually you can get the diagnosis from these and therefore then treat them with this and they'll get better, then you don't need to worry too much about your bloods and radiology, because actually it's not going to add anything to your puzzle because you've already found out what the puzzle looks like, okay? But you want to find out a little bit more about what the puzzle looks like. If they are still unwell or really unwell, or you've still not got the full picture. And a lot of you have written really good answers so far. So bloods wise, you want to look at the infection and inflammatory markers. So full blood count, CRP, and then using these help you look at the kidney function, which are urea and electrolytes, and it helps you also look out for, and within the FBC, I think someone's just put white cell count. You can get the full blood count, so you can get white cell count and your hemoglobin within that, okay? Radiology-wise, a lot of you have put it, but a chest X-ray would be excellent, okay? So that is how we then investigate. And then after that, we then want to do some management, because he's obviously unwell enough that he's worried about how he's doing, but also we're worried because of how long the condition is going on or what's going on with the condition. And the management all depends on what you think the puzzle looks like. If you think the puzzle looks like a chest infection, then you're going to want to start them on some antibiotics. If you're thinking it's more of a viral picture, so COVID or flu, then you just want to start them on antipyretics. So those that help bring the temperature down, so such as paracetamol or ibuprofen, okay? And they're really important and ones that you need to explore. If they're needing oxygen because their saturations are low, then again, add some oxygen on, okay? And that will all be within their management. But that right there, ladies and gentlemen, is a very quick fly through of what it's like taking a history from a patient, what it's like developing that picture from speaking to the patient, from then finding out a little bit about kind of what is in our mind with regards to differential diagnosis, how we then translate that into investigating the patient, and how we then translate all of that into thinking what we think is going on and then managing that patient. Okay. So we've gone through all of this. And what do you think would be the most likely diagnosis for this patient? So we've got a little list here. And so, beautiful, we've come to a stage where we're thinking it's most likely either bronchitis or pneumonia. And that's exactly the stage where we would probably be with the information that we have so far, because obviously we don't have any more investigation results. And therefore, from that, we can then give some treatment for that patient. So well done. I hope you enjoyed kind of a little bit of kind of an insight into what it's like taking a history or talking to a patient, a little bit about kind of what it takes or what you think about in a doctor's mind to get to the point of treating that patient. But as it's important doing this or going into a GP practice or doing work experience or going from or working in your local shop or working in a restaurant or doing voluntary work, that is all really important. But there's one element of all of that that helps glue everything together, and that is reflection. So what we're going to do is we're going to talk a little bit about reflection. Reflection is one of those things that you never really get told the importance of it during school that much. You kind of just do it naturally. And we as humans will all naturally reflect on events. But let's explore what reflection is and why it is so important. So reflection helps show you what you have learned from your experience. So say you've spent some time in a GP practice, it helps you sit down and think about kind of what you might have taken away from that. Reflection shows what skills that are required from that role, but also what skills that you have developed and kind of worked on. It gives you a better awareness of your own strengths and weaknesses. And it helps you really understand what it's like being a doctor, or the importance of kind of being a doctor within the NHS. Now, reflection, like I said, is something that we don't normally get told, but we do it naturally, okay? If you got your results, your A-level results, and you did really well, you instantly will, in your head, reflect on how you kind of had done well and all the work that you put in and how that had kind of contributed together to where you are now. If you have played football and you lost a football game, okay, you're then going to spend some time reflecting on your performance. Whether you kind of were prepared before you went into the football game, what happened during that football game, where you kind of not on your top form, should you have done different passes? Should you have done kind of played a bit differently or different styles because of the opposition? Reflect on what the opposition were like. And therefore you are reflecting on that experience of that football match and what your skills were and what your strengths and weaknesses were in that experience. So we do it very naturally, we do it all the time. But when we come to medicine, you need to show that you're always reflecting before you get into med school, because it helps make your work experience look so much better, because it shows me that you've thought about the importance of the work experience you've done and how you've kind of related that to being a doctor. During med school and during being a doctor, you have to reflect constantly, because there are so many experiences that you're going to have to constantly develop on. If you see a patient who's really unwell, you're going to have to reflect on what treatment you did, how you did it, how you responded, how you worked within the team, what your strengths and weaknesses were. If you get a complaint from a patient, you need to reflect on why the complaint happened, what was going on with you, what was going on with the team. There's lots of different areas that you need to reflect on. But reflecting early and getting that practice in from now means it makes a big difference. Now, there's reflecting in your head and there's reflecting by writing down. Reflecting in your head, we do it, like I said, naturally all the time. And you might think, oh, I've done work experience, I reflect in my head, and that's great. But the issue with reflecting in your head is you might remember the key skills or the key takeaway message, but you won't remember the full reflection that you've done. And therefore, when you come to think about applying to med school, or think about doing your personal statements, or think about applying for your jobs, think about making sure you write down things. You write down your strengths and weaknesses. You write down your skills that you're good at, why you're good at it, why you're good at it. Show us why you're good at it. Show us about the experience. To start from the beginning, what was the experience, and work your way through it. By doing that, when you come back to think about it later on, say, for example, you've done work experience this year, this summer, and your interview is in 2023 or 2024, whatever you end up doing it. You then are able to quickly reflect or quickly look back at the reflection that you've done and then make it relevant and kind of attach it to what you're doing today. What we do is we use this cycle called Gibbs reflective cycle. Now, this is a cycle that's used in most universities. There's lots of different reflection frameworks that you can use. And if you Google reflection frameworks, you can really explore all the different reflection frameworks there are and can have an idea as to which one fits you the best. Gibbs is used in most places because of just how smooth and how it intertwines with each other. And as you can see there, you can start off with reflection in this cycle in anywhere, because it's a cycle. So you can start off with analyzing what's gone on and then work your way around it. But usually what most people do will start off by describing the work experience they've done. How were you feeling through that work experience? Evaluate what the skills were that you developed during that and how you did that. Analyze your own performance within that. Come to some conclusions about the work experience you've done. And then from that, think about some action plans that you're going to do. Those action plans will then feed into your next experience. And then that can then keep the cycle going. So here's a bit of an example of what I mean by reflection. So for example, today we were in a GP practice, and you can think about, okay, well, let's describe that GP practice. And you can think about, well, I was working in the GP practice and I observed a doctor talk to a patient who was talking about depression. And then you can think about, how did that make you feel? I thought the patient was really empathetic with the patient when discussing their depression. Then evaluation and analysis, you can then think about, okay, I observed the patient's body language and relax in response to this and respond to the doctor. And they were much more comfortable in discussing their difficult situation to the calming language used. And then we can conclude and come up with an action plan. This is a skill that I understand is important, as it can help someone who feels vulnerable to open up. And one I plan to embrace and develop in the future to become a better doctor. Now, you can further develop that by then thinking about, okay, well, how do I want to develop that? What are the specifics I want to do to try and get that skill that I have figured out from that patient? The empathy, the importance of empathy to being a doctor. Develop it, work on it. And through that, you can really show off who you are, why you are perfect for being a medical student, and why you will fit into the medical school that you apply to, and eventually why you will be tomorrow's best doctor. On that note, we'll give you a little break, and then we'll come back and explore a few different areas again. I hope you guys enjoyed that. There's lots of different things that we did. We got you a little bit more involved thinking about chest conditions. We got you thinking a little bit, but the importance of this is work experience is essential when you're thinking not only about medicine, but about any other kind of career you go down to, whether it is your job that you want to apply to. Say you're applying to work in Sainsbury's or Tesco's, for example, or you want to apply to work in an Urban Outfitters. Work experience of figuring out whether that works for you and then reflecting on that is really important. Get your work experience in, get yourself stuck in, be persistent, persevere. And once you've done it, reflect on it, write it down, keep it to one side so you can use it in your interviews, okay? And then hopefully we'll get to see some of you people apply to some universities, especially if you end up applying to Newcastle and you're lucky enough to have me as an interviewer. So best of luck. I'm sure you guys will absolutely smash it. There's lots of different things you have to think about. Now you're kind of growing up into the adult world of learning. Keep developing yourself, keep getting stuck in, never give up, always follow your dreams, and you'll eventually get there. Okay? Enjoy your break. See you guys in a bit.
Hi everyone, welcome back. For this next little part, me and Finn are going to talk about how to balance school and applying to medical school at the same time. So really important, how to manage your workload. The first thing really is time management. So I would really recommend organising your time in advance, maybe planning your weeks in advance, because you guys are going to have school, let's say 9 to 5. And after that, you're going to have to plan your revision, maybe things like personal statement writing, UCAT and stuff in the summer, but also making sure you leave time for hobbies and relaxing as well. And you need to organise your work experience in year 12. You'll probably have the majority of your free time in year 12 and the remaining time you've got left of year 11. So it's really important you try to do as much volunteering, extracurricular now, just because in year 13, it's such a tightly packed year and you will be a bit rushed for time. And I'd also say find your favourite revision techniques. So that depends on you and how you learn, but making sure that the time you spend revising is fully effective for you. And again, revising effectively. So for example, with your A-levels, making sure you revise what's tested in the specifications and what could come up in your exams, rather than, let's say, kind of learning everything that's taught to you. And again, practicing loads of paper questions as well.
And I was just going to add on to that quickly. Learning the best way to revise for you is really important. You've got a lot of time right now to really find out what works for you. And I know that for me, I kind of took a bit too long maybe to find out the best way to revise. All through GCSE and A-level, I was mostly kind of writing out notes to memorize things. And I was doing questions on the side, to practice my knowledge. But there was a lot of writing involved, which really wasn't that efficient. And it wasn't until I came to university that I really worked out what sort of ways best helped me memorize stuff. So that's something really to look into now as you've got the time, and it will allow you to revise for exams for A-levels and so on into the future more effectively, and so should save you time in the long term.
And I think touching on that, I know quite a common revision method is to maybe write everything out. And I think if you know that you're someone that does that, that might be something that you need to adapt a little bit. So going into med school and stuff, you might not have the time to write everything out. So starting now, you might think, could I type things out? Could I do it in note form? If you physically think you can't change it, then that's a case of putting more time into your timetable. If you know that's a better revision method for you, that's fine, but making sure you put in enough time to kind of count for that.
Yeah. And then kind of moving on from that, it's really hard to learn if you're kind of overstressed and overworked. So making sure that your mental health is as good as it can be is really important. You need to make sure that you're having regular time out to just relax. And whether that's kind of a long period of time, like an hour or whatever in between working, or even if it's just, 5-10 minutes between revision sessions of just listening to music and just de-stressing a little bit, it will allow your brain to absorb more information and means that you're less likely to waste time when you're actually revising. This kind of leads on to finding placements that you will enjoy when you're trying to gain work experience or volunteering. Obviously, with volunteering and stuff like that, it can get a little bit boring at times. But if you've chosen something that you generally have an interest in anyway, it will be a lot easier for yourself and will allow you to kind of learn more from either the work experience or the volunteering that you're carrying out. And so that will be way more useful for yourself. And relaxing, socializing is really important to prevent burnout. especially in A levels, everyone's working quite hard, whether you're doing the same subjects as some of your peers, or if you're doing different subjects, everyone is working. And it can be really useful just to relax, talk to other people, even if they're not doing the same subjects as you, because you really want to prevent the burnout, whether that's kind of throughout year 13, year 12 and 13. Obviously, you need to get those A levels, so you don't want to burn out then, but also you don't want to be getting your AAA to get into med school and then realise that you're just so burnt out from doing A levels that you physically can't do university at that point. So you do need to kind of balance these things. And that's with this last bit as well. So don't abandon your hobby. So whatever you really enjoy doing can allow you to de-stress and relax. And by abandoning that, you're just going to increase your stress levels. And so will probably revise less effectively anyway. So by keeping that hobby, even if it's, let's say you play football 2 hours every week, you really shouldn't stop that, even when you're revising, because it will allow you to kind of get that exercise in and allow you, once again, not to have any burnout and still be able to revise effectively.
Exactly. And just like Finn said, this isn't the next 2 years, this is kind of the rest of your life. And if you're choosing a profession like medicine, then managing stress is really kind of a lifelong thing you need to harness. And exactly just like you said, you need to manage your stress, because it actually helps you perform better if you kind of keep that under control. And there's loads of ways you can kind of manage your stress, like Finn said, exercising regularly, making sure you leave time for your hobbies, whatever those hobbies are, reading, writing, etc. Being organized. I know a lot of people in my year who kind of plan their week. So getting into it now is a really good habit when you get into med school. Practicing things like meditation and mindfulness, having kind of 5 minutes at the start of the day, just take a deep breath and kind of clear your mind. And really, really important, if you are struggling, then talk to someone, whether that's a friend, family, school. You're not alone. This is something that kind of you are going to be stressed probably throughout med school and after. So really important that you do talk about it.
Yeah, and just with that, especially with the struggling, just because you are struggling at any point, having trouble with your mental health or anything like that, a lot of people and doctors specifically will have troubles with their mental health throughout their career. So that doesn't mean that you're not suited. Just because you're having that, depression or anxiety at that point doesn't mean you can't get through it and then continue on to having a successful career in medicine.
Yeah, I completely agree. I can only speak from kind of a medical school perspective, but the uni are really, really supportive of mental health and stress and struggling. They know kind of the pressure of medicine. So you are continuously supported in med school, and similarly, look for support with your friends and family and school.
So one of the main stresses, I suppose, for yourselves, other than A levels themselves, will be preparing for the UCAT or the UCAT and the VMAT. So to minimize the stress for that, you really want to be making sure that there is enough preparation time. So with this, most people try and allocate about 6 weeks. And that's what we'd suggest, a minimum of 6 weeks. You don't really want to be going too much or too little, because of same with burnout. You don't want to get so bored that you're just doing the same questions over and over again if you do, let's say, 12 weeks. But at the same time, you have to realize that 3 weeks probably isn't enough to get the score that you're probably hoping for. So that's one thing that you really need to kind of allocate time for. And that's what you're going to have to think about when you book your exam. Be realistic about your revision time. So that kind of links in with the 6 weeks preparation time. So for 6 weeks, you might be starting, let's say, do a couple of hours a day and slowly build up but realistically, you might be a person who can get to kind of 6-8 hours a day of just steady work for the UCAT, but you can't be doing kind of 12-hour days. You can't leave it, say, oh, I'll revise for 3 weeks, 12 hours a day, every day. It's just not going to be feasible. And you're going to just not learn as much as you probably would by spreading that time out. You need to focus on your weaknesses. So as I mentioned earlier, I struggled quite a lot with the reading part of the UCAT, and the speed reading, especially within that. So I had to spend a lot of time on that, just to kind of bring my average score further up, so that although I had the other sections to kind of bring that up, you don't want your weaknesses to be dragging you down particularly. With that as well, don't just use one practice resource. You want to be using books, online courses, a lot of people do, and practice questions from a range of different websites, to make sure that you're as well prepared as possible and that you've seen the most range of questions, because the UCAT and the VMAT aren't like a lot of exams that you would have done in the past. So it is a skill in themselves, just answering those questions. As you go on, to start off with, you'll obviously just be getting the hang of reading the questions and understanding what you have to do. But as you go further forward, these exams are quite heavily time-based. So it's it's quite a rush basically to get through all of the questions. And that's one big thing that you need to learn for the UCAT and VMAT, the timings. And so practicing under exam conditions is really important, to allow yourself that practice so you don't get too stressed within the exam and then obviously make mistakes. And with all of this, you need to be keeping up with your hobbies or whatever you enjoy. If you're just revising for the UCAT or the VMAT, you're not going to learn as much as you think. You may be sitting there for 8, 9, whatever hours it is, but realistically, you might only be learning for 3 of those hours because you're just so bored not doing what you enjoy just outside of that. So make sure that you keep up with your hobbies so that you can learn as effectively as possible.
And I think, kind of carrying on what you said, Finn, if you guys don't kind of get the score you wanted in your UCAT, I think remember that it's not the end of the world. You can resit your UCAT, you can resit your VMAT. So I would probably say not predicted grades, your actual grades are probably what's most important, because you can always reapply the next year if you did get 3 A's. And I'd also say if you didn't perform well in the UCAT, you have the VMAT as kind of a backup. And also remember, I mean, I can speak for Newcastle, but Newcastle use the UCAT as a cut-off for interview. So if you perform over a certain amount, you get enough for interview, then they don't really look at the UCAT anymore. So maybe look at your score compared to previous years, and then look at universities that use it as a cut-off for interview rather than see like your overall offer.
Yeah, I think that's really important. Look at the universities that you would like to go to, and many of them will have scores from previous years that was the cutoff for interviews. So you know, then applying to that you'll either likely get an interview or not from that. And just with the resitting, you can't resit it in the same year. So let's say you did it in year 12 and you didn't get a very high score for your UCAT or your BMAT or whatever, for whatever one you wanted to go for. You can't resit it that year. You have to wait till the year after. So you'd be waiting till the year after in year 13, the summer of year 13. So yeah, I think that's very important.
So we're going to recap what you guys need to be doing this year in year 12, and then Finn's going to talk about year 13. So again, considering your course options, is medicine definitely what you want to do? And if so, do you want to do a foundation year? Do you want to do a 5-year course, a 6-year course? And obviously, which university do you want? And depending on that, do the uni need a UCAT, a VMAT, or both? And making sure that you guys get lots and lots of work experience or anything equivalent to work experience. So extracurricular, volunteering, talks. So timeline wise, June, book your UCAT. In summer, July to September, you're going to sit the UCAT, and also you'll start drafting your personal statement as well.
Yeah, and I think with that, considering your course options, so what medical schools you might be applying for is really important. So I know when I applied, I did make a few little mistakes. So as you saw before, the universities that I applied to, one of them was Leicester, and I didn't get an interview there. And the reason I didn't get an interview there was because I hadn't checked their points ranking thoroughly enough, I suppose, before that point. And my GCSEs weren't of a high enough score to allow me to get an interview at Leicester, but I hadn't fully seen that before applying. So that is something that you definitely want to look into, and make sure that from all of your kind of your UCAT or BMAT and your GCSEs, if they want them, you need to look at that and the points that that will give you, and whether that's kind of likely that you'll get an interview or not, because obviously you want to give yourself the best chance possible to be able to get into that med school. So then moving on to year 13. So you want to be getting any last minute work experience in, probably preferably before kind of October the 15th. So if you learn anything that's really useful or get any skills that you can prove for your personal statement, that you can put it in there. You want to be obviously finishing up your personal statement and finalising your university choices. As I'm sure probably the summer before year 13, you probably will have maybe visited a couple of them or done some online kind of tours. And they can be really useful to allow you to choose what universities might be best for you, whether you think that's a campus university or a city university, because they can be quite different in the experience. With your UCAS application, the date for that is going to be the 15th of October, that's going to be in. So that's the last day that can be submitted. November will be when you sit your BMAT, if you've decided to do that exam. And then hopefully you'll be getting your interviews around November to April time and attend those. And if you manage to do quite well in those, then you just have to wait for May, where you'll sit your A-levels, and hopefully with the offers, you will be able to get in once you get your grades.
Okay, so we're going to round up with a Q&A. We're going to bring Dr. Mo in here if you've got any questions kind of past medical school, and hopefully we can answer questions from medical school and before that.
So I'll just take a minute to set up, I think.
Okay, I don't know if you guys can hear me, but I'm going to try and read the questions out from here. Can you guys hear me? Can I just get a thumbs up if you can hear me there?
Yeah.
Yeah. Okay, cool. I'll try and control the questions from here, and I'll kind of read them out and tick them off as we're going. And then if anybody wants to chip in, then feel free. And for the students that are watching as well, this is the time to use the Q&A function, which is down at the bottom of the screen. If there's already questions that are in there that you want answering, you can just hit the thumbs up button. It brings them to the top, so we can actually see the most popular questions, and we can try and get through the most popular questions for everybody. So the first question here is from Mildred, and is doing an EPQ worth it for medicine?
So I personally didn't sit an EPQ. I know some people who did. I would say maybe do an EPQ if you know that it's not going to take up too much of your time. It's useful in the sense that it's an extracurricular and it's something to talk about in interview and in your personal statement. But I think if you've got other things that you can talk about, then it's not needed. I think most importantly, just make sure you leave enough time, obviously, to get the grades you need. And if you can fit an EPQ in that, then that's great because that's more to talk about.
Yeah, following on from that, I think that it sounds like quite a good thing to do a lot of the time. And if it's something you're really interested in, do it. I started doing it and I've started writing all the projects because I was really interested in at the time in kind of infectious diseases and tropical diseases. So I did it all about that. And it gave me some things to talk about in my interview, but I never actually finished the EPQ because of kind of tidying it up. So I think from the experience, I learned quite a lot, but it doesn't matter in the sense of actually kind of getting into med school.
Okay, cool. The next question, Dan, is from Rohan. When is a good time to start preparing for the UCAT and VMAT?
So UCAT wise, it was a bit different for us because we had AS levels, but I started revising in probably about June time and my UCAT was in September. So, I mean, that is a long time, but also I had holidays and stuff planned within that. So I didn't have kind of solid weeks of revision. But I feel like that's the case for most people. I mean, you guys are going to have plans and stuff, so you can't do 6 weeks of full revision. So if you know that, just kind of start a bit earlier and plan that in advance.
Yeah, I think that obviously starting earlier is going to be very useful. So once you've kind of finished your school year, at least getting a kind of idea of what the UCAT might be about or the VMAT might be about. And then you can kind of work out how much time you think you're going to need, whether you think you're going to need kind of longer than 6 weeks to revise for it properly, or maybe slightly less. But obviously, you want to make sure that you're spending as much time on possible for these. It is going to be hard with a lot of your friends being out if they're not applying to medicine. You know, having the summer free, it is something that you're going to have to do and it will take a lot of time. But what you have to remember is it is really important for your career going forward. Medicine is so hard to get into and it's really kind of oversubscribed. So you do have to try and get the best grade possible to give you the best chance of getting an interview.
And maybe this one is for Mo. Someone said, I did some online work experience. How valuable is online ones compared to being in the setting? How do you kind of judge this when you've been interviewing at Newcastle?
How valuable is work experience volunteering?
Very. It's the best way to show that you are developing as a human being. It's the best way to show that you know what it takes to be a doctor. It's the best way to show that you know what kind of skills are relevant to being a doctor and how you are developing yourself to be that person. It also shows us how keen you are to do medicine. If I've got 2 students kind of come in and one of them has kind of said, oh, I know what it's like to be a doctor. I've spoken to kind of my dad. I've done this, I've done that. Compared to someone who's gone out of their way to really try and get lots of experience in and lots of stuff in, like inadvertently, we're going to kind of compare the two, and you're obviously going to have the one that you think is more interested and more keen to do medicine. Because if you're showing that you've got that interest, then you can really pass it on when you're going into medicine. The other thing is that universities also look at keeping people into medicine. Like I said before, med school is really tough, medicine is really tough. If we think that actually you've really found out what it's like to be in it, and therefore you're more likely to stay in it, then we would rather prefer that than someone who's just kind of gone into it thinking, oh, I've always wanted to do it, but doesn't really know why. Comes into it, the reality is very different to kind of their perception of what medicine was like, and therefore end up deciding they don't want to do it or drop out and stuff like that. So again, universities are interested in keeping people. So I'd say invaluable, try and get as much as possible. Don't stop until you kind of got to a point, well, don't stop until you interview really, and after.
The next question is, What are the best universities to apply to when doing medicine? This is something we get asked quite a lot. So I don't know if you can kind of shed a little bit of light on this one.
So I think there are lists published every year of the rankings for universities for medicine. But I think what you do have to understand is that they're all producing doctors. So there isn't going to be a massive difference between a lot of them. It will be differences in the way they teach maybe, or some of the resources they have. But it's more about what you think is probably the best university to fit for you. For some people, Oxford and Cambridge might be the one that they really want to and what they might fit into best. But some people might realise that they really don't think that the way Oxford and Cambridge teach will suit them. So they might be kind of looking for something else and prefer other universities such as, Newcastle or Liverpool or something like that.
I'll jump in and say a pretty bold statement, but try not to look at the ranking tables. Yes, it's important for other specialties and other careers because it might make a difference when you're coming to apply for further jobs. In medicine, it makes absolutely no difference. Once you've graduated and you've got that degree in your hand, it doesn't matter which university you've gone from. You are on the same level as anyone else. You get ranked on the same level as anyone else, and you choose your foundation jobs together with everyone else. No, you don't get an extra point for going to Cambridge or Oxford. You don't get one less point for going to Newcastle or anywhere else, okay? It's all a level playing field. The most important thing is, like you said, the most important thing is find a university that suits you, not only in your learning styles, but also suits you in your strengths. So your strengths are how good you've done in your UCAT, whether you've done the VMAT or not, what your GCSEs and A-levels are and what options you've done in them, and how strong you are in interviews. Do you like MMIs? Do you like one-person interviews? What type of interviews do you think you're going to sell yourself best in? Choose that university that suits you. You will do really well getting in and you'll do really well in med school. Don't look at the ranking tables.
Okay. Next question is where should we be looking to volunteer? Do we look at the NHS or do we look for kind of local doctors and local practices?
I didn't personally look on the NHS. I think a lot of it is maybe word of mouth. My friend did some volunteering and I managed to get in with her. Asking the school, asking kind of around the local community. But yeah, there are things on kind of like job websites as well for volunteering, for things like charity shops and stuff. So I would look there personally.
Yeah, so with that, I think charities are really good. Kind of anything to do with that. So, if you're part of any sort of religious group, like a church or anything like that, you can often find charities within that, kind of local charities, which might be a lot easier to get into. Even if you're not religious, just go along, then we'll normally be more than happy to get some more help in. And with the kind of work experience, obviously it's a lot harder right now with COVID, but just apply to anything. If you get rejected, well, oh well, you've tried. But as long as you've applied to as many places as possible, you will find someone eventually who's happy even if it's just for you to come in for a couple of hours. Anything's better than nothing, basically.
Yeah, I'll jump in and say it kind of is, you'll always find somewhere needing volunteer work. There's food banks. They are kind of obviously quite big at the moment with everything that's gone with COVID and a lot of people unfortunately needing a lot of support. So there is a lot of work that you can do within that. No real place will kind of turn you down for you wanting to volunteer and give your time to that place. Try and maybe find something that you might be interested in. I did some volunteering at a prison, which is pretty cool. So I did I did it for a little bit longer than a year, where I was working with kind of family members who came in to visit people in prison. So it was kind of within that, and I did that every Saturday, Sunday. Most Saturdays, Sundays for kind of an hour or so in the morning. That was really good. Charity shops are the kind of the classical places you can also kind of go to.
yes, you can look at NHS websites, but the thing is with most places, especially for kind of work experience, they're not going to advertise it because they know they'll just get thousands of people kind of go for it. And in actual fact, it's more you gaining from it than the university or the hospital gaining from you being there, if that makes sense. And the other thing is, you're not the first student from your, hopefully you're not the first student from your school that's applying to medicine. There will be connections that your head of sixth form will have had. There will be people your head of sixth form will know. Speak to them, have a little chat with other people that are also kind of applying. The other thing is, sometimes you might be applying with your friends. It might feel like it's a competition between you and your friend getting into medicine, but don't see it that way. Try and help each other. If you help them, you're more likely to kind of better both of yourselves. We're not going to look at an interview and say, oh, well, these both people from the same school, therefore I'm going to choose one of you. Absolutely not. Try and help each other, push each other along. You get a lot more from kind of helping them, as well as kind of knowing the resources or where they've gone to as well.
The next question will be quite relevant to all of the students watching, is because they've just obviously got their GCSE results. And the question is simple: is what GCSE grades do I need? I guess some universities use it and some don't. Am I right with that?
Yes. So some universities will rank you on GCSEs, and they'll generally be like, they'll tell you that basically before in your application. The main thing for GCSEs is obviously getting the grades so you can do the A levels you want. So obviously, if you want to do chemistry, you need, generally for most schools or colleges, you need an A in GCSE chemistry. Some of the things might have changed recently. Obviously, with exams not being sat, things with universities may have changed a little bit, but that will be a university by university thing.
Yeah, I would agree with that. I think it depends on the university. Like, from personal experience, I know Edinburgh put quite a high weighting on it, but places like Liverpool and Manchester didn't. But I would say don't worry too much about your GCSEs. Out of the entire UCAT application, I'd probably say it's one of the least important. So if you haven't done that well, or maybe not got the grades you wanted, then just focus more on other stuff.
I'd second that. If you don't know, ask. If you're more like the universities will always publish a lot of data on their website with regards to what students have come in with, where they come in from, etc., etc., etc. If they'll also publish what the requirements are, what the A-level requirements are, GCSE requirements are, and that's where you need to spend a lot of time doing your research. That's where you find out what university suits you. If there is information there that you don't know, so for example, it doesn't say anything about GCSE requirements, every university will have a department or kind of a group of people who are in charge of the entry requirements. Give them a phone call, okay? Give them a phone call, ask them a question, send them an email, you will get an answer, okay? And that means you'll get more information out of that way, and kind of take it further. Information is key.
Yeah, I think speaking to universities is really important, and then at least you hear it directly from them. Just looking at the next question from Fiona. Is it preferred to do 4 A-levels or 3 A-levels with an EPQ? I guess you're only normally given an offer based on 3 grades, aren't you? So yeah. What did you guys do?
So I took a bit of a weirder route, I suppose, for my A-levels. I found physics a lot easier than I found biology. So what I decided to do was I applied to universities that required chemistry and at least one other science. And then I did biology to AS. So you still had to have biology to AS. So I got an A in that, but then I dropped it and did chemistry, physics, and maths. But I didn't do anything else. So they'll give you an offer and that will tell you what you need. And generally it will just be 3 A's, and it will tell you either, 2 sciences or chemistry and biology, or biology and another science, depending on what university it is. And they're the things that you basically have to look for.
Yeah, so for mine, I did the 3 sciences. and I did maths as well, and I dropped physics at AS. I know people who did do 4 A levels, but I do think it's a lot of work. But if it's a subject you really enjoy and you really want to do it, then there's no harm. But obviously, bearing in mind you still need to get the predicted grades. So I think maybe focus on 3 A's, and if you think you have the time and you really enjoy something, then go for it.
The next question.
Well, go on. I was going to just jump in and say, I think, like you said, 3 A levels. If you try and do 4 because you think you're going to stand out, you probably aren't. You're going to probably be more at risk of hindering yourself than of gaining the fact that you've got 4 subjects in 3. You have to realize that by dropping that 4 subjects, you're giving a lot of time to apply to medicine, prepare for your your personal statements, prepare for your interviews, which are all during the year, which are all time that you're going to have to be obviously studying for your other 3 subjects. But not only that, then when it comes to exam times, when it comes to pressure time, it gives you that just a bit of extra time to do other social activities, so such as sport or doing things that just helps you perform much better in those 3. And therefore 3 guaranteed really good grades is way better than kind of slowly hindering yourself throughout the year by pushing yourself to your limit doing 4.
Okay, thank you. We have another question here, which is about gap years. I was wondering, will taking a gap year before starting a medical university course put me at a disadvantage?
Will a gap year put you at a disadvantage?
So it's a difficult question because a lot of people think about whether it makes a difference or not when you come to apply. Now, there are, I think, very few universities which say it does make a difference. But in my kind of history, I mean, I'm here and I had 2 gap years, and they were the 2 best years I've had in my last kind of 20 years. I would not say do not take a gap year if you're worried about the fact that you didn't get in. Now, a lot of people are forced into having a gap year because they didn't get into medicine. If you're into that, then that's fine. Make sure that you still kind of use the beginning part to really show off yourself and really develop yourself. And if you're able to do that and show yourself off, then you'll be way better when you come to apply than you were the time before. Reflection as well. Obviously, if you didn't get in the first time, reflect on why you didn't get in. Ask for feedback. Reflect on where things you can improve on. Improve on it at the beginning part of your gap year. Then find stuff that you enjoy. So I absolutely love traveling. I got to do lots of really cool stuff in my gap years. So I volunteered at the London Olympics. I worked in an orphanage in Sudan for 3 months. I went to the Middle East and was able to start on a startup company because they hired me, wanted me there. So that was, again, an experience that I've never done before. And then I got to travel a bit of Far East Asia, which, again, once you're in med school, is much harder to do. So I went into med school, first year of med school, with all these really cool stories about the things I've done for the year, compared to people who kind of been pushed or that have kind of flown through schools and done really well to get in. But obviously then it's just a different life experience. Don't be put off by taking a gap year. I absolutely love mine. And it's why I'm doing this teaching fellow job, because at the end of the day, yes, it's important to work towards an occupation, to work towards a career that you want to do, but life is all about the experiences that you develop throughout that.
Okay, the next one, does this Zoom meeting count as work experience? I think it definitely counts as experience, and I think you hopefully will learn a lot from it. I think you've got a lot more time given where you are at, you're just starting year 12. There's still a lot more work experience that you can kind of get. But definitely, we're going to have lots and lots of webinars coming up in the future to help you with your kind of application process. We tend to do webinars every couple of weeks, not as long as this, but kind of 45 minutes where we focus on a specific part. So maybe try and keep up with those. Like the guy said before, and they were talking about work experience, then you can definitely go and find that and start looking for that now during year 12. And then if you did want to kind of have a look at any of the actual work experience courses that we run as well, then take a look at those slightly later on. Just looking down the next questions here. Which one is harder, UCAT or VMAT? I guess this depends. Well, what do you guys think?
So I think it very much kind of depends on yourself. Some people will find one easier than the other. With the BMAT, some of the questions are going to be similar to things that you've learned in the past, whereas the UCAT is very new for most people. You won't have done much of it at all, so it can be quite alien. They are both hard. Like, that is basically the point of them, to be hard, to kind of differentiate people. But it is just basically practice. So it's going to be hard, but it's just something that if you want to apply to medicine, that you're going to have to get through.
I would second that. I think the BMAT tends to focus a lot more on kind of honing in your GCSE science skills and math skills, and kind of the other parts are quite similar to the UCAT. So I think there's kind of pros and cons of both. I would say they're equally hard as well. I think it depends on you. Obviously, the harder thing about the UCAT is that it's in summer, so a lot of people don't revise because it's in summer. But two, it's new things. You won't have ever done abstract reasoning, for example. But kind of the pros of that is that everyone's in the same boat, and that also means that you can stand out if you kind of revise effectively, start revising early, things like that.
I never did the BMAT because I was that student in A level where I was like, meh, like, I don't want to do extra work. I'll do what is needed, but that was it. It's probably why I didn't get in first time. But when you're thinking about these exams, it is all about prep work, and we've talked a lot about kind of preparing and kind of getting ready. Now, BMAT you can prepare for by kind of doing a lot of study for kind of your basic sciences and stuff like that, and you can kind of develop that. But UCAT wise, it actually is meant to be an exam that you're not meant to really get better by revising. But what you do improve is how familiar you are with the exam, how familiar you are with the different types of questions and what the questions are, but also time. Really, really work on how quick you are at answering them and working your way through it, because actually that's probably the best way of getting a better score than actually sitting there and trying to memorize the different ways of figuring out what abstract reasoning is or what you look for, because it's not meant to be something that you can kind of work out and carry on, if that makes sense, but you can recognize patterns, and by doing that and speeding up, you get much better in the actual exam.
Okay, the next question here is about extracurricular activities. What do you think are good extracurricular activities for your personal statement, and what did you guys do?
So for me, I think it's anything that you really enjoy. So I did mention that I played football in a football team, but it was more to show my commitment, because I'd played with them for, I think it was about 12 or 13 years at that point. And I hadn't like moved around. I'd been playing with the same club for that amount of time. So it was more about showing commitment. So I think that with any of the kind of hobbies or anything, if you're going to mention it, you need to be using it to show a skill or show something that you want the examiner or whoever the person is who's reading your personal statement to actually realize or gain from reading it.
Yeah, I would agree. I think any extracurricular is good, but even better if, for example, with a sport, if you played it to county level, because that just shows kind of the time and dedication you've put in. So I put that in my personal statement. Things like musical instruments, like if you've got to a certain grade, or if you did drama at school, for example, and you helped organise these productions, that will also help you kind of stand out. But I think, again, any extracurricular is good. It's kind of what you've learned from it and how you can use it to show that you've got these skills that would make you a great doctor, essentially.
And I'd say, just to kind of finish up on that, I think a lot of people are naturally gifted in sports, and a lot of people are naturally gifted in a lot of different kind of musical kind of instruments and stuff like that. You don't feel that if you're not gifted in them, that doesn't mean that I'm not going to be able to get into medicine. Absolutely not. There is still obviously so many different ways that you can still sell yourself. Extracurricular activities, yes, it's good to kind of work your way, and if you have done it and well done to you, and then you can show that off, absolutely. But if you haven't, then that's absolutely fine. You need to find other things that make you relax, because essentially what I'm looking for when I'm interviewing is when you become a doctor and it becomes really stressful and there's a lot of responsibility on you, and you come out of your long day at work, what things are you going to do outside of work to get you back into kind of a good mindset, so that the next day you're not affected by what's happened before? So what are your relaxation methods? What things do you enjoy doing outside of work? You might already know that because you've obviously been doing it while doing your GCSEs. It might be something you're going to develop while doing your A-levels. Find something that helps you kind of relax, sell that, and actually that looks much better than just kind of going, well, I've done this and I've done that and I've done this, because actually sometimes listing it might not even be useful at all.
Okay, somebody here has asked about revision techniques. We've currently got 385 open questions, so I don't think we're going to get through all of those. So I think we'll probably take a couple more, and I'll jump back into the studio and probably just do a bit of a wrap up about some of the free resources, and thank you guys for coming in. So last couple of questions. This one is about revision techniques. How did you work out what your revision techniques were and how they worked for you, and what are they for you?
So for me, I found it useful. I know at GCSE we had exam specifications, especially for the sciences. So I kind of looked at the learning outcomes and then I used that. I do like writing out notes, but I'm a much quicker typer, so I started typing out a lot of my notes. But for some things like diagrams and stuff were useful. So I think my revision technique kind of changed a little bit. From a med school perspective now, I find it more useful to type out all of my notes. And I, like at med school, you have learning outcomes that your exams are based on. So I would kind of type out and copy the notes that were in lectures based on the learning outcomes. So yeah, it's changed a bit, kind of coming from med school to GCSE and A-level, but yeah.
Yeah, so for me, in GCSE and A-level, there was a lot of writing. I wasn't that efficient. I did a lot of writing out things and rewriting things to kind of make them stick in my head. I did do past papers, but since coming to med school, I definitely use a lot more questions. So past paper questions are really useful, especially for medical exams. And I use kind of flashcards as well. So places like Anki, you can make your own flashcards and space them out in a way that is kind of giving you the reminder. So to start off with, you might be learning it, every week, and then it will spread out, but you won't forget it because it will tell you about it in a month again.
It's a question about revision styles.
Revisions, yeah, styles.
So I'm your typical last minute reviser. So I am happy to confidently say that I will leave all my revision to last minute. I am very chilled as a human. Very little kind of puts me off. And so, and I see Mark there laughing because I do stress the medical projects a little bit about how chilled I am. But the reality of it is that by just being that chilled, there are people who are last minute revisers, and you will find that when you come into university, you split into two groups. You'll split into a group that everyone who studies really, really early on and have the most beautiful mind maps. And you have a group and they look at anyone who studies last minute as foreigners and go, what are you doing? Why do you always leave that so late? And then you have those who are studying last minute and they look at everyone who's done so much work before and go, well, why are you not living your life? And you completely engage within kind of medicine life. So you will always have your two different parts. My advice to you is be confident in the fact that you might be different to everyone else. Be confident in which group you are. Kind of don't let that stress you out, but use that style to kind of fit you. I'm a more visual learner, so my type of learning was always about kind of colors. I didn't really make notes, mainly because I didn't really have that much time to make notes, but it was more about kind of getting all the information. But for me, it was about understanding. And my best way of understanding was teaching. So I used to kind of try and understand things and then teach topics to my friends, to other people in at uni. And by teaching it, I then further understood it, and it then sticks. Because then by understanding it, then I'd be able to interpret whatever was given to me and kind of adjust it to what was needed, if that makes sense. There are the rote learners. Again, if you're a rote learner who sits there and just memorize it, fine, accept that you're a rote learner and kind of work your way through it. There was earlier in the session, there was a talk about how important it is to realize your learning style. It's really important to realize your learning style really early on, because actually it makes a big difference to not only your A levels, but also when you come into university, because by understanding it, you can then develop that and be confident in that and then work towards that kind of going further forward. Otherwise, you'll just be lost in no man's land trying to study how other people study, but not how you study the best you can.
Okay, thank you. And this is quite a nice question to finish on. Do doctors and medical students have much of a social life? I know we've spent a lot of time talking about how many things you have to do in the next 18 months. Well, you guys have been through this process. Did you manage to have a social life during A levels and during medical school and now being a doctor?
Yeah, so I think that for me personally, the stress of kind of getting into medical school and doing A levels at the same time, I think I had a lot less of a social life in year 12 and 13 than I actually did once I got into med school. I think that there is a lot of learning to do at med school, but your exams are kind of spaced out. So depending on how you do your revision, you do have time to go out and do other things, be part of societies. I've been part of many societies. I've been on committees for different societies as well. So you do have time for that sort of stuff as well, as long as you kind of, I suppose, make sure that you've got time for both. You just have to balance it a little bit.
I would probably agree with that. You do definitely have time for social life. I would agree that I probably had a bit less in kind of like the summer of year 12, for example, and during interviews. But you do have time for social life. I mean, I still went on holiday before my A levels and stuff. So you definitely can. And I agree with Finn with med school. I think one of the regrets I have is just kind of revising so much in like first and second year, because now we're in fourth year, we've kind of got like our final academic score, and really your exams in first and second year are worth about 1% at Newcastle. They're really, really kind of minimum. So yeah, you definitely have time for social life.
I second both her points. But my thing is, I think social life is probably more important than work life. It's really important that you're not kind of thinking, oh, work is all that, and kind of making sure that you have time to live your life. Because I don't want to take this into kind of a little motivation, life is short type of talk, but essentially, you need to kind of have the time to make sure you relax. You need to have the time to make sure you do other activities, to see family, to see friends, to do other hobbies that you might have, because once that's gone, once that year's gone, you'll look back and think, actually, I had a lot of chance to do that. I had a lot of time to do lots of different things that you might have thought at that time, actually, I didn't have. And actually, you might then look back at it and with a bit of regret, as opposed to looking back and thinking, do you know what, I actually lived to the best that I could kind of back in the time. When it comes to university, get yourself stuck in, get yourself doing lots of different activities, lots of different societies. You can always taper them down when it gets closer to exams. Everyone understands in university that you are there for a degree, you're there for a university education. So no one's going to turn around and go, oh, why are you not turning up to this football game or this? I did American football for my fourth year, and I was the old curriculum, and fourth year was the biggest exam that we had for the whole med school. So when it came close to exams, there were two games that were literally like the weekend before the exam, and the boss was like, honestly, don't worry about it. I know you're here for a medical degree. I know you're not here to further your American football degree career. So everyone understands. But actually, now I look back, I absolutely loved my American football time, apart from getting a few knee injuries. But so like you need to live your life without having kind of any regrets. The main thing as well is by doing that until you graduate. When you become a doctor, you need to have your social life. Everyone talks about how important it is, but you don't actually realize how important it is until that first day that you're working and you've got patients that you're responsible for. You've got things that you need to do for patients. You've got jobs that are coming out of your ears, and you finish your day shift and you're like, I'm absolutely shattered. But that's when you realize the importance of having a social life. That's why the importance of having a healthy life with regards to kind of sports and exercise and stuff like that. It helps with your stress, helps physically as well. So yeah, really important.
Okay, cool.
As well.
Yeah, thank you very much for answering those questions. We're going to have to do a little bit of magic now, where I'm going to have to go from here back into the studio so I can kind of wrap up this course. I just want to talk through some of the free resources and things, and kind of point all the students towards kind of the important bits on the website and things as well. So we might have to roll the video transition a couple of times while I quickly run from here over there, but I'll see you back in a few seconds. Okay, there we go. Magic. I'm back in the studio. I just wanted to quickly wrap up by thanking everybody that's been involved in making this event happen today. There's a whole team that makes this entire TV studio work. So I just want to say thank you to those guys. And a big thank you again to Mo, Finn and Flora as well for giving up their Saturday afternoon to come and speak to you guys and talk to you about their experiences. You've got a long journey, a difficult journey ahead of you, but hopefully by kind of watching this course today and then this webinar today, you've got a really clear picture of what's coming up for you in the next few weeks and months. We're going to be there throughout that whole journey with you as well. We run live webinars throughout the year as well. So we'll cover all these different topics on our webinars. And so hopefully we'll see you back on those webinars. Again, we have free articles written by current medical students and doctors on our website. So go and check those out. Or if you want to go and look at any of our other webinars that we've done, they're all on our YouTube channel as well. Just have a quick Google for medical projects and you'll find all our things there. Yeah, huge thank you for tuning in and spending a couple of hours with us on this Saturday afternoon. We really hope that you've enjoyed it and you found it really useful, and you hopefully will feel much more confident going forward with your medical school application, and you'll have a really clear picture of what you need to do over the next kind of weeks and months. That's it from us. Enjoy the rest of your weekend, and we'll see you throughout the next 18 months and on to becoming medical students and eventually doctors. It's been a pleasure. Thank you very much.